There we go. Woo! Hello, YouTube. Hello, hello, hello. Well, hello there, everybody. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, February 7th. Time for yet another support group meeting. Now, of course, it is Super Bowl Sunday. So, we're just going to see if people don't want to do it today. That's fine with me. If y'all do, I'm here to take your questions. My goal in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody to give you grief about your symptoms. I don't want anybody to tell you that it's all in your head. You are injured. Your condition is real. Your pain is real. And my job today is to try to open a few more doors. What we'd like to do is see if we can figure out if you've missed something. If you've done bladder therapies for 5, 10, 15, 20 years and you're just not getting better, well, let's figure that out. Maybe there's something else going on. Like if, for example, during the day, as you go through the day, you notice that you feel like you're carrying a bowling ball around in your pelvis. Yeah, you've got frequency urgency, but you got this really severe heaviness. And that probably is pelvic congestion syndrome. And guess what? Bladder therapies won't fix that, but it is very, very fixable. Our challenge with pelvic pain is that Western medicine pretty much fails the pelvic pain patient because doctors are very comfortable staying in their box. They stay in their sandbox. They don't look outside their sandbox. And here's the reality: there's a lot of structures in the pelvis that influence each other. We've got muscles, we got nerves, we got bones, we got organs, we've got blood vessels, and they do not operate independently. They are remarkably influential. And so if you, for example, notice that your symptoms started after having a baby, well, that makes sense. A lot of patients do. If your symptoms began after falling on your tailbone, that also makes sense because it happens to a lot of patients. I think our challenge here is how stunning it is that patients will be on bladder medications for years and they never get better. And what the American Urology Association guidelines now very clearly say to you and to your doctor is, hey, if you're not responding to therapy, if you're getting worse rather than better, man, we got to take a step back here and reconsider this position. Maybe we have missed something. Maybe we have missed something. Could you have a Tarlov cyst? Could you have a fibroid tumor pushing on your bladder? Could you have another condition which is triggering your symptoms? Hello, Laura. Hello, Shannon. Shannon says, another pain-free week, baby. Woohoo! That's what we like to see. Hello, Anne. Nice to see you. Hi, Ruth. Hello, Helen. Susan, are there any IC-friendly cough drops? Yes, there are. Go for honey-based cough drops. Look for, oh gosh, you know what? I can get you the brand, over on our website, icnetwork.org. There's an article that I wrote last year. Every couple of years, we end up surveying patients for their best cold and flu strategies. And I will tell you, hands down, the cough drops and the sore throat drops that work the best for IC patients is always going to be a honey-based one. So if you can find honey-based suckers to suck on, or look for, just look for the honey-based ones. Also, I'm going to say for the last 10 years, I've had a number of patients talk to me about traditional medicinals, herbal teas. And it just comes up over and over and over how good these teas are for IC patients. They swear by them. And so we now carry them in our store. And let me show them to you. Organic throat coat herbal tea. And breathe easy. This would be the two herbal teas that, again, multiple patients over the years say that they have worked very well for them. I learned something important though, and that is you can't do a lot of licorice over time. You got to be careful with licorice because it does have some long-term effects. Now, I'll wash my hair, but it's all weird. Oh well, it is what it is. You could Susan. So again, Susan says she can't find a cough drop that won't cause pain. So again, look for honey-based suckers. I've got, you know what? Hold on. I know I have one. Hold on. Yes, 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 yes. I have them. Woohoo! All right. So look for these. Burt's Bees honey drops, throat drops, and honeys. Okay. So for those of you dealing with coughs, colds, flus, tragically COVID, these are going to be the ones that are going to be the most bladder friendly by far. Okay. Laura says, I'm doing installations at the moment, not stopping the constant urge to urinate. Laura, what kind of installations are you doing? Hi, Jill. Nice to see you. Always nice to see other Jills. Hi, Carolyn. Well, half my family just got exposed to COVID, so not my group of family. My mother is 92, and it's her birthday tomorrow, and we were hoping to at least have an outdoor gathering, but nope, they all have to stay away. It's pretty frustrating, but it is what it is. Karima says, my mom has been suffering from IC for the past 5 years. The flares have become extremely unbearable this past year. She's just so desperate for help, living so far away from her. I don't know how to assist her. Well, Karima, remember, it always begins with anatomy. We have to understand her anatomy, what could be going on in her body. And the very first thing we have to look at for a woman who's older is estrogen atrophy. Is she struggling with what we call the genital urinary syndrome of menopause? The bladder. So here's a little anatomy lesson for you. So when you were a little tiny bundle of cells in your mother's uterus, right? And the miracle of life is amazing. If you've ever watched cells duplicate and create living things, it's absolutely stunning. So the question is how is a bladder made and the urethra made and the vulva and the vagina for women? And the answer is they all come from the same cell called um, the collective term is the urogenital sinus. So it is the urogenital sinus that as that fetus grows, diversifies and creates your bladder and your urethra and your vulva and your vagina, right? And so because they are so interconnected, they are all dependent on hormones. So that kind of makes sense, right? But urethra and your bladder as a woman needs estrogen. It needs estrogen to produce that nice thick coating of mucus. And unfortunately, that mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus and you're gold. When you're older and going through perimenopause and menopause, postmenopausal, guess what? Y'all don't have the estrogen like me. Things start to get dry. And unfortunately, because your bladder no longer has that nice thick coating of mucus, things that you might have been able to enjoy in your 30s and 40s, all of a sudden you can't enjoy in your 40s and 50s. And that's because your bladder can't defend itself. It's not a disease. Sorry, my hair is all weird. It is just aging. It's just estrogen atrophy. I'm having a very weird hair day today. Hello, John. It's nice to see you. I hope you're doing well today. Now, you guys, I'm simulcasting live on Facebook and YouTube. And I had a chance to look at one of my last videos, and I was stunned at how bad the video quality was. And that is because my internet where I am is pretty limited. So I'm bringing in a brand new internet service, which is going to cost 4 times as much, but it's going to allow us to do better videos. Dottie on YouTube says, I love honeys. Hello, Denise. Hi, Elise. Hi, Barbara. Elise says, licorice is my favorite candy. Maybe it's triggered my symptoms. Have just stopped eating it since my doctor told me it would not be good for your blood pressure. Licorice doesn't damage your bladder, but I think it messes with your heart if you do a lot of it. I love licorice. Hello, Debbie. Karima, thank you so much for those stars. I really appreciate it. Guys, if you appreciate these support group meetings and you're on Facebook, you can give me stars, or y'all can come on over to the IC Network website and become a member and get our wonderful magazine, the IC Optimist. Patty says, tomorrow is 1 week post-hysterectomy. Doing well, but it did not go to plan. My bowels and my bladder were cemented to my, holy crap. But my doctor looked inside my bladder too, and there was no injury on the inside. Ooh, girl, how, wow. Did they have to do a bigger incision for you because of that? Hello, Angie. Hi, Susan. Mary says, does the IC Network have a distributor in Canada? The cost of post here is the same. No, we don't. We don't, unfortunately. There used to be a Canada IC Society, and that folded. It was so sad because they had plenty of money. Money wasn't the problem. They just didn't have the volunteers to do the work. So the IC network, the Canada IC Society folded about 15 years ago. Then I ran the Canada IC network for some time, but then I just I folded it right back into the IC network. So yeah, you have to get it from the IC network. What I would suggest for those of you that are in Canada is if you have any, there are two ways to do it. A lot of Canadians have a US postal box. So if you're close to the border, you can come down to the US and get a postal box. And then you will only pay American prices and you just drive it over the border. Or if you have somebody in America that we can ship it to, then we can ship it to them and then they can send it to you as a gift potentially. But we cannot declare that your purchase is a gift. We can't lose our shipping license, our shipping opportunity. It's not a license, just a shipping opportunity. There are severe punishments. Emma says, I've just finished a course of bladder installations. Am I now able to take Sister Protect? Will this help with ongoing pain? Well, Sister Protect wouldn't be my first choice if you're a pain patient. My first choice would be Bladder Builder because it has a pain-fighting ingredient in it called palmitoyl ethanolamide, also known as PEA. You guys, Sister Protect now has an extended manufacturer shortage. We are down to our last couple of bottles. Let me look and I can tell you. Hold on, I got to just turn on this other computer. And I can tell you what's happening with Sister Protect. Let's see. Somebody in the distributor's office forgot to order it last fall. Now there's a 4-month wait to get the next shipment. So let's see where we are with Sister Protect. All right, I got 30 bottles left. 30 bottles of Sister Protect. Then there will be no more. So if you need Sister Protect, go get it done. But again, remember, Sister Protect is a bit of an older formula, and we've learned a lot about IC since then. And one of the things that we've learned is how important it is to calm nerves down. And that's why many of the other supplements kind of stepped forward and started to do better, like Sister Renew, Bladder Builder, Allopath, Peora are basically better targeted. Oh, look at that. There's a squirrel right outside my window. Aw, look at that cutie. Oh, he's adorable. All right. Shannon says, I wanted to talk to you because I've been on Elmeron for 2 years and then a week ago found out from my eye doctor that you have macular degeneration. I talked to the urologist and he had me stop the Elmeron and now he's doing installations of heparin. I go to the eye doctor every year for my checkups. Can only 2 years of Elmeron cause the eye issues? Yes. We have patients reporting changes in their vision in the first year. And if you look at the FDA warning for Elmeron, so for people who are watching this for the first time, it's important to know that the only oral drug approved for interstitial cystitis, called Elmeron, has now been clearly linked to a devastating eye disease called pigmentary maculopathy. And we now have patients who are going blind. And we don't necessarily know why. I have, hold on, I can show you pictures. Hold on. Let's see here. Where is my file on my eye stuff? Where is it? Okay, well, my file on Elmeron is somewhere in the office right now. Okay, so let me just explain what happened. So about 3 years ago now, researchers at the Emory Eye Institute, they were referred several IC patients all showed a weird retinal disease. Their retinal cells, the cells on their retina, were changing color. And the patients were having trouble reading, but most importantly, they were having trouble going into dark rooms. You know how if you walk into a movie theater and the movie's on, you have to wait at the back of the room for your eyes to adjust? That kind of stops happening with this type of retinal disease. It takes much longer for the retina to adjust. Hold on. And so there can be blurry vision, there can be squiggly lines in the vision, there can be blind spots in the vision. And so here you've got retinal specialists who are just baffled. Why does this group of patients have this weird eye disease? And when they did their history, what they could see is that they were all taking Elmeron or had taken Elmeron. So they published their first paper, and there's now 13 studies. I mean, there are many, many papers on this now where they were able to show the eye damage. And apparently, a metabolite of Elmeron, or the Elmeron molecule itself, is actually attaching to the cells of the retina. And so they wrote a letter to the Journal of Urology. I'm the one who broke the story to you. I found the letter to the editor. I emailed my medical board, said, "Hey guys, well, do you know anything about this?" And I decided to credibility test it because it didn't make sense that somebody with a bladder disease would have an eye issue. And so we did our own study. I've got 2,000 patients now in our study. 54% of Elmeron users are reporting retinal disease. 54%. Stunning number. So I sent our early data off to Phil Hanno at Stanford, as the chairman of the AUA committee. He said it was absolutely stellar research. Asked me to send it to the FDA to see if we could get the FDA to put a warning label on it. It took 2 years, but we did get the warning label. In that time, multiple research studies have now been done. Pretty much every eye doctor now is aware of this. They are and the challenge, of course, is now treatment. We have one research study that shows that there is one treatment that appears to be somewhat helpful, and it's a weird name. Let me get it for you. Hold on a sec. So we only have one study about a therapy at this date, and it was, let's see here, V as in Victor, E as in Eric, G as in George, F as in Frank. Researchers in Canada shared a case study of 59-year-old women with non-leaking cystoid macular edema associated with pigmentary maculopathy and Elmeron use. Multimodal imaging showed all the features that they would expect. She was treated successfully with intravitreal injections of bevacizumab. This report is the first to demonstrate that pentosan polysulfate associated eye disease can be non-leaking on an angiography and responds well to intravitreal anti-VEGF. So you can find that information in that study over on a website I built for that called Pentosan Disease or pentosaneyedisease.org. That's P as in Paul, E, N as in Nancy, TOSAN. That's the generic name for Elmeron, pentosaneyedisease.org. I did not buy Elmeron eye disease because I did not want to get sued by that pharmaceutical company. Probably should have, but I didn't. Okay. So yeah, girl, you got Shannon, you got to keep on top of your eyes. And in the meantime, I have an Elmeron transition guide for those of you who are stopping Elmeron. You've done the logical first step. You've done a bladder installation. You're doing that provides a coating effect with the heparin. And what I would think about adding to that perhaps would be a chondroitin-based supplement that would also give you a bit of a bladder coating effect. Debbie says, I've been having a lot of urethral pain lately. Doing a lidocaine ointment? Any other suggestions? So Debbie, we've got an article, The 7 Causes of Urethral Pain, right over on our website. It's a blog I wrote a couple years ago. And I think you will find that very, very helpful. Again, we always look first to estrogen atrophy. The urethra is kind of like the canary in the coal mine when it comes to estrogen atrophy. And so it's the urethra that will first start screaming. Look at you guys. Hello, Dottie. So Elise, Denise says, I had a car accident because of Elmeron in my first year of use. Girl, yikes. Dottie says, yep, I have pigmentary maculopathy after 20 years of Elmeron. My central vision is holding, but the peripheral is shot. I'm only 64. Dottie says, nothing can regenerate dead tissue. The rods and cones in my retinas are crumbling. Dottie, I really hope that you're participating in one of the lawsuits. If you go to the website elmeronlawsuits.org or .com, elmeronlawsuits.org or .com, that's the legal team that we have been working with. And you might want to call them and take their quiz and see if they're somebody you'd like to work with. You guys, the statute of limitations is running quick. Some states, the statute of limitations is 1 year, other states is 2 years, other states is 5 years. It's very, very important that you, for anybody with eye issues, you want to make sure that you save your rights. Donna, hello, Donna. Nice to see you. I hope you're doing well. Angie says she bought the delicious pumpkin spice rooibos tea from the IC network, and it's delicious. I'm glad you like it. I love it. That's what I drink every day. When it comes to finding an IC friendly herbal tea, it's challenging. Herbal blends often have things like rose tips, which can be a little bit more acidic. And so we do better with very simple teas, a plain chamomile, a plain peppermint, or a rooibos tea. Rooibos is a brown grain, and you can find all of those in our store on our website. And then we have a new one. This is kind of cool called Chill. And Chill is a blend of peppermint, chamomile, and hemp CBD, hemp CBD. And this is made by the same company that makes the pumpkin spice rooibos tea. So chamomile and mint are massively blended to create a caffeine-free herbal infusion. It's combined with 16 milligrams of hemp extract to make a delicious brew to end your day. They say our body relaxing, mood elevating infusions deliver a cool, calm, and delicious experience like no other. We strive to make it all just a little nicer in everything that we do. Yeah. So this is Harney and Sons. I really like that company. We've been selling their teas for a year. Their CBD line is brand new last year. So this is our first time we brought this in. Carolyn, thank you so much for your stars. 3 weeks in a row. I really appreciate that, hon. Laura, can stool softeners flare the bladder? Could you maybe advise on one that is not? I'm really suffering. How do I want to say this? the bowel and the bladder are intricately connected because your nerves are connected. We have research that shows that if the bowel gets irritated, the bladder will also be irritated. If the bladder gets irritated, the bowel will be irritated. And that's because the nerves from both merge at the spinal cord and they become the same nerve. And so you are going through what we all go through, myself included, that when you find that you're getting constipated or you're having bowel spasms or anything at all like that, your bladder is going to act up in all likelihood too. Um, we do better with soluble fibers, a soluble fiber that dissolves in water. We don't do so well with insoluble fibers like um, Metamucil or psyllium husk. Those are actually pretty irritating for those of us who tend to be a bit more on the sensitive side. We do better with acacia fiber. And the ones that I use every day at this point in time, because, you know, what we're going through is remarkably stressful, right? With COVID and everything. And I don't know about you, but man, I turned to cinnamon rolls. I just bought some more today. I haven't had one yet today, which is why my stomach is just a wee bit bigger. Um, the problem with that, of course, is that white bread just isn't a good source of fiber, and so a lot of us are dealing with constipation and hard stools and things like that, myself included. So, um, let's see. So Heather's tummy fibers are just fabulous. They're absolutely fabulous for those of us who tend to be a little bit more on the sensitive side. And they have these are the travel packets. And so what's really cool is, look, I mean, you just cut it and pour it into your water. It has no taste to it. It's not thick. It's not chalky, nothing like that. This is so good. So if you're struggling with hard stools or constipation, this would be something that you could try, Heather's tummy fiber. Or the other one that we have is called Regular Girl, which also has some prebiotics and probiotics in it. And patients also rave about this. So between these two, these are good. Most IC patients do well with Miralax. So Laura, have you tried Miralax at all? Even Docusate, Biscotal. Yeah. I mean, again, I would be looking. Remember, for a woman to have a healthy bowel movement, you need to have 20 to 25 grams of fiber a day. For a man to be healthy, it's 25 to 30 grams of fiber a day. So I double dog dare you to look at the labels and count up your fiber. You might think you're eating enough, and the odds are you're probably eating under 10 grams of fiber a day. And that's when things get hard and rough and painful. You gotta lift it up. A lot of people eat salads because they think lettuce has a lot of fiber. It doesn't. One serving of lettuce has like 1 gram of fiber in it. So you could be eating a big salads and you're not getting what you need. In contrast, 1 cup of green peas is 13 grams of fiber. 13 grams of fiber. So we eat a lot of peas and beans in our family. Let me say, almost every day. Becky says, I got a sample of the fiber from one of your IC network orders. I may try it tonight. Yeah, give it a shot. Give it a shot. Carolyn says, happy birthday to my mom. Thank you, hon. She'll be 92. Mary says, estrogen creams make me burn more. Well, hon, the reason why you burn is because you're dry. You don't have a nice coating in there that will protect you from chemicals. And so anything you put on your vulva when you dry is going to burn it first. But the thing about the estrogen is that your body immediately starts to use it to produce mucus. And so for me, it took about 10 days for the burning to go away. But that's a common mistake that many women make is you're really dry, you finally go to the doctor goes, wow, you're really dry. They give you an estrogen cream. And the first time you use it, it burns like heck and you don't want to use it again. But the burning is really a direct reflection of how dry your skin is. And what you'll find is every subsequent time you use it, the dryness should get better and better and better. The only exception to that is Premarin. Premarin is a brand name that comes from pregnant mare urine. It's an industry that I personally despise. I don't believe in keeping horses pregnant and killing the babies like they do. Um, um, Premarin has a lot of preservatives in it and a lot of potential irritants in it. And so we generally don't recommend the brand names. Getting a compounded preservative-free estrogen cream is essential. But again, that burning sensation is usually a direct reflection of how dry your skin is, Mary. Don't freak out about it. What you'll find, and Google, do me a favor and just search for topical estrogen safety so that you can look at the research studies. And in those research studies, you're going to see very clearly with pictures in many studies how quickly those tissues start to regenerate and repair. Shanna says, oh, Shanna, thank you. Are there any estrogens or phytoestrogens at work that you can get without a prescription? There's plant-based estrogens, obviously, that you can get. I actually kind of went that way. I wanted to try that at first, but here's the problem. They were all made in China, and I have no interest in taking anything from China at this point in time, and so I chose not to go that route. Patty, who had her hysterectomy and found that her bladder and bowel were attached to her uterus, said they did not have to do a bigger surgery, but it took 3 hours to unstick everything and get the uterus out. Girl, woo! I sympathize greatly having gone through that myself. I'm feeling a little sympathetic pulling right now down below. You're gonna get, that's the one thing you can count on is healing is always happening. Healing is always happening. Your body is trying to fix whatever the hell's wrong in your bladder, wherever. The challenge is we often get in the way. And in the case of something like hysterectomy and surgery, guys, it's a long recovery. Hysterectomy is about one of the worst surgeries that you can have as a woman because it's taking out really vital bits. And the recovery time, I mean, they have to cut tendons and ligaments and blood vessels and all that sort of stuff. And then you've got pretty major muscle trauma. And so understand, Patty, that you've got probably 90-day stitches. They're going to be real stitches for 90 days. And those stitches can pull and pop at any time. I popped an incision at 6 weeks. I mean, I popped a stitch at 6 weeks, bending over and picking up a t-shirt off of my floor in my bedroom. So follow those post-surgical instructions. No lifting for at least 3 months, maybe 6 months. Okay. Timmy says, so grateful I found the IC network. I was diagnosed with IC just a few weeks ago, and it is really difficult to live with it. Keep up the good work. Greetings from Hungary. Hello, Hungary. Thank you for joining us. So, Timmy, listen, girl, this is all about understanding your anatomy. Like I have been playing, playing isn't quite right word. I have been working with a guy by email for the last couple of days, and he says he has really, really severe IC. And so I kind of went through the basics. Okay, is it from your pelvic floor? Is it from chemotherapy or chemical injury? Things like that. And he just said, no, I just have IC. I just have IC. Help me. And it's like, it's not quite that easy. We have to understand what's driving your symptoms. And in his last email, he admitted that he was drinking a lot of coffee every day. So I've got to respond and talk about how coffee is neurostimulatory. Coffee is profoundly acidic, but also neurostimulatory, and it's going to turn those frequency urgency nerves on. Why do we drink coffee anyway in the morning? For a lot of us, it's because you have a bowel movement. Why? Because it stimulates a nerve. So it's well known that coffee and caffeine will make you pee more and will make you poop more. So I'm not sure what his case is. I hope to help him a little bit more. Debbie says, I am new. I was just diagnosed last week. I'm not sure I definitely have it. I have to get some other things checked out. Do you want to look inside? And do you want to look inside with the camera? I'm a nervous wreck about it. They prescribe medicine, but I don't like to take it. I'm doing marshmallow root tea, eating a lot better, drinking a lot of tea. Well, girl, you got to be really careful with the tea you're drinking. It should only be chamomile or peppermint, and understand that half the people who do marshmallow root tea flare from it. You say it's on your left side. The pain is really bad, but I also have spinal problems, lower spine problems too, and I have hardware in my neck. So, Debbie, we no longer think of IC as an incurable bladder disease, and we haven't for a decade. We think of IC as a pelvic pain syndrome. Why? Because we know structures outside of the bladder are also involved, if not driving the bladder symptoms. In many cases, the bladder is a secondary victim of some other dysfunction happening in their pelvis, like a fibroid tumor pushing on your bladder, or endometriosis that's attached to your bladder, or a Tarlov cyst. Or for many patients, it begins with a muscle trauma, a major muscle trauma. If you fell and broke your tailbone, that is a classic injury that we see in the IC patient population. And so it's really hard to talk about therapies until we understand your anatomy. We got to figure out your anatomy first and try to understand what's driving those symptoms. And we do that with something called subtyping. And so let me just go through the subtypes real quick. I know I do it at almost every meeting, so a lot of you should have this memorized, right? And you know what, man? I have not even eaten today. Hold on. Let me take a couple bites of my coconut blueberry coconut yogurt, coconut milk yogurt. I have been running like a chicken with my head cut off today. All right. Alrighty then. So let us go over these subtypes real quick. So let me just give you a little bit of history here. Up until 2008, everybody at that point in time believed that IC was specifically and uniquely a bladder disease. But in 2008, something very, very remarkable happened, and that is that the National Institutes of Health released their first research study on pelvic floor physical therapy. And what they found was that pelvic floor physical therapy was stunningly successful at reducing IC symptoms. And it was at that moment that the world went, uh-oh, well, if this were a bladder problem, muscle therapy wouldn't work. So clearly, for some people, muscles are involved. And so we knew that in 2008, and now that's just expanded. We now know, and we're really tracking a lot of other things that can cause this. And in fact, we had a research study released last summer, that showed that 70% of men with testicular pain had an underlying orthopedic hip problem. So now we're really very clearly understanding the bony structures, your hip bones, your SI joint, your knees, your feet can also actually cause bladder symptoms. It's weird, but it makes sense. So, of course, the great tragedy in the IC movement is that many of you have been on bladder therapies for years and you've never gotten better. And at some point in time, y'all got to stop and ask your doctor, hey, listen, I'm not getting better. Let's try something else. Can we take a step back and see if we missed anything? And so it is Dr. Christopher Payne, who ran the Stanford IC research program for many years, who came up with subtypes, which have helped tremendously. In fact, I was just talking to professor at Harvard Medical School about that on Friday, saying we need to give him recognition because his system is so good. And so here we go. The 5 subtypes of IC. And I think he nailed it. So when he created his paper, he did it in a really provocative way because he said, we should be treating IC patients like cancer patients. And I'm like reading that going, oh my God, don't say cancer and scare people. There's no connection between IC and cancer. And he said, no, 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 no. What you're not understanding is that when somebody is diagnosed with cancer, they don't just say you have cancer. They give you a very, very clear diagnosis. Like for mine 3 years ago, complex endometrial hyperplasia with atypia and a vague architectural complex, which means early uterine cancer. That's just starting to grow tumors, right? Okay. And so a cancer diagnosis is so specific and clear that both the doctor and the patient can walk out of that room knowing what their treatment options are. And he argues very successfully that a diagnosis of IC does not really help, that you don't know what to do next. The doctors often don't know what to do next. And so, how can we give you an intuitive treatment pathway that is with a more specific diagnosis? And so, using his system, we can create a more specific diagnosis for you. So, in his system, subtype 1 is Hunner's lesions. So if you're peeing blood clots, if you've got massive blood in your urine, if you're in severe pain, you are in this group. You could be in this group. And normally, if you have a lot of blood in your urine, that's when you want your doctor to immediately look inside your bladder to see if they can figure out what's going on. Hunner's lesions, these patients are down to eating 4 or 5 foods. They live in severe pain until they are treated correctly. So Hunner's lesions don't respond to bladder therapies. They don't respond to rescue installations or Elmeron. Hunner's lesions need lesion-specific therapy, and if you treat them correctly, the pain usually goes away. So they can cauterize the lesion or they can inject it with a steroid. What's interesting about Hunner's lesions is that when you biopsy them, and look, here's a picture. So these are pictures of lesions. Right? And so you'll notice that there is a center lesion with arms radiating from it. There's a real big one. This is a good one right here. I mean, not good as in good. I mean, it's just a good picture. When you biopsy a lesion, there is warfare happening in that tissue. The inflammation is massive. And inflammation tells us that your immune system is fighting something. And interestingly, only Hunner's lesion patients have inflammation in their bladder. The rest of us don't. We now have pretty compelling evidence that suggests that lesions are caused by viral infections. That was research first done in Europe. They found the polyoma BK virus, Epstein-Barr virus, and years later, last year, the National Institutes of Health released their own virus study where they too found the polyoma virus in the bladder walls of a small subset of IC patients. And now with COVID, guys, we're doing our first COVID study. And in our COVID study, we have more than 100 patients in that study so far. 75% report that their symptoms get much worse with COVID. 25% severe symptoms, and COVID is bringing them out of remission. And COVID is making their therapies not work as well. So the question is, why would somebody get much, much worse during a COVID infection? And the answer is that we think that it's infecting the bladder. We have 14 studies that have shown live virus in the urine of IC patients. We also have studies showing that COVID infects the kidneys. So the next logical step is, could it be infecting the bladder wall? And I'm going to suspect that in that 25% of patients who report that their symptoms get much severe, that it probably could be in their bladder wall. Okay. So now we understand why Hunner's lesion patients don't respond to traditional therapies. Now we understand why lesion-specific therapy is important. And the nice thing about this is this is opening up new treatment pathways. Perhaps using antiviral medications, using lysine as a supplement. Those are things which are all worth consideration. All right. So that's subtype 1. So again, if you have blood in your urine, you got a lot of blood in your urine, European blood clots, normally you want somebody to look in your bladder very quickly to see what the hell's bleeding. And if it's a lesion, they should be treating the lesion at that time. One of the greatest tragedies are patients who have a hydrodistension, they tell them they have lesions and they don't do anything. And they leave that patient to suffer. In many cases, they don't do it because they just don't have the equipment to do it. And so if you're ever scheduled for a hydrodistension and somebody's going to look in your bladder, before you go into the OR, you ask them, what are you going to do if you find a lesion? And if they say nothing, then you're going to say, I don't know about that. I don't want to have this again. If you find something, I really want you to treat it at that time, right? And that's normally the way lesions are treated. But for some of you, it's very sad. You've been in pain for years and you know you have lesions. Nobody's ever treated them. Alrighty. IC subtype 2 is bladder wall driven because the bladder, like any other part of the body, can be hurt. It's possible. It's not the biggest subtype. You might think this is the biggest subtype in the IC world. It's not. It's a medium subtype. So generally, when it comes to the bladder, we're going to look at 3 key issues. Number 1, chemical injury. So these are the patients whose symptoms begin after chemotherapy or because you have a horrible diet and you only drink diet soda, right? The bladder, remember, your bladder was built for life 5,000 years ago. It's not built to handle massive levels of acid. And so the bladder wall absolutely can be injured. And if you're continuing to drink coffee or soda every day, then you are crippling the ability of any therapy to work for you. No therapy can counteract the damage that a 6-pack of soda will do to your bladder or even a cup of coffee a day. You have to create an environment that will support healing. That means you got to lose all the irritants for like 3 months. The bladder is the slowest healing organ in the body. Nothing happens overnight. You can't follow the diet for a week and think you're going to get better. Nothing happens in a week. It takes 2 weeks for one cell to be replaced. So generally, you have to follow the diet for at least 3 months, if not 6 months, to create an environment that will allow the bladder to repair itself. That's why it's very important that you don't think of IC as an incurable disease, because it's not. And Chris Payne said that in his article. But what it is for some of us is injuries, and injuries heal. Injuries can heal. People can be cured depending upon their subtype, right? So you could be a new man or woman if you just lost a soda. And you know who I'm sending vibes right now to somebody whose name starts with an E and it's 4 letters. You know, right? Okay. The second thing we're going to look at with the health of the bladder wall is going to be the estrogen levels. And if you're dry, do you have estrogen atrophy? If you do, your bladder can't defend itself. And so if your vulva is dry and your vagina is dry, so is your urethra and so is your bladder. And that's a moment where using a topical estrogen is helpful, as well as potentially a therapy that will provide a little bit of an extra coating effect on your bladder. So that might be a heparin installation, or it would have been Elmeron before we knew about the Elmeron causing the eye issues. And today it's really going to be the chondroitin-based supplements. Let's see here. Let me just show these to you so that you have a little bit of context here. So this is the most effective for people with subtype 2 bladder wall driven, okay? So Cystoprotec was created by an IC researcher, Dr. Theoharis 20 years ago, has long been the top supplement, but they went through some pretty hard times 2 years ago, and it was not available. And so other companies stepped in to fill the void. And again, Cystoprotec is not available again. So Bladder Builder is a chondroitin-based supplement that also has a pain-fighting ingredient in it called PEA. So this right now, opinion, is the most robust top supplement. The challenge is it's got a lot of stuff in it, including probiotics. And if you flare with probiotics, you're not going to be able to take Bladder Builder. And so the better formula is going to be for somebody super, super sensitive, it's going to be Bladder Rest because it's a really clean formula with fewer ingredients. And so it's better targetable so we can try to figure out what and avoid whatever might be whatever you might be sensitive to. It's also in an avocado oil base rather than an olive oil base. And that makes it more heat tolerant. We have Cystomend. And so this is this is replacing Cystoprotec at this point in time as an option. So same ingredients as Cystoprotec, a little bit more with the addition of a little bit of pumpkin seed extract. So, and it's $5 cheaper. So Cystomend is a viable option. And then for those of you who like aloe, the soothing effect of aloe, we have Aloe Path, which is a combination of organic anthraquinone-free aloe with PEA for the pain fighting effect. So those are generally the supplements that many patients turn to. There are a couple of others on the market. One of the ones on the market is Bladder Ease. And the challenge with Bladder Ease is that the bioflavonoids come from citrus, which is unfortunate because citrus can be irritating for us. You want to look for a product, especially those of you in the United Kingdom or in Europe or in Canada, and you can't afford the shipping fees or we don't ship to you. Go to your store and look for a product that contains chondroitin and quercetin, and you want to make sure it's not citrus-based quercetin. It needs to be from the Sephora plant. Sleepy Bookworm on YouTube says, she's from the UK. I'm your subtype bladder while you're in constant pain. Do any of the supplements you sell help with this supplements? Yeah, hun, absolutely. So again, if you're in constant pain, the one that I would be looking at is Bladder Builder. We just did our 1-year follow-up study with that. And I published the data on our website. You can go on over to icnetwork.org and check that out. But basically, 60% of the patients who tried Bladder Builder are still on it. They report of those patients, 25% were now pain-free, which is what we thought would happen. It's what we hoped would happen with the addition of PEA. They had shorter flares, they had less painful flares, and they had fewer flares. But 40% stopped using Bladder Builder, number one, because they either couldn't afford it, number two, their doctor wanted them to do something else, or number three, they had a gut-related side effect, which happens with all of the supplements. None of these supplements are side effect free. And that's why we always tell patients, don't take the full dose on the first day. Start with 1 capsule and just see how you do. Like for me, I took Cystoprotec, but I could take 1, no problem. But if I went to 2, I had loose bowel. If I went to 3, I had major diarrhea. 1 a day worked for me. So we all have our different sensitivity levels, right? So start slow with anything, but those would be the ones that. So Sleepy Bookworm, look for in Europe, it's called UMPEA. UMP, uh, uh, UMP is the formula that was used in the IC research study that was published 2 years ago. And I think it comes out of Italy. Right now, we are not shipping to the United Kingdom because you're requiring that we collect VAT tax at the time of purchase, and we don't have the software to do that right now. So if you've got somebody who lives in the United States that we can ship it to, and then they can send it to you as a gift, that's the workaround. But we can't ship it right now to the United Kingdom because we simply don't have the software to be able to determine what the VAT tax would be. One of the consequences of Brexit, sadly. You guys, I don't even think I introduced myself. So again, Jill Osborne, president of the IC Network. I'm the national leader. I think at this point in time, I'm the longest serving support group leader in the world. I've been doing this for 28 years. This year, I bring to you 3 college degrees, a degree in chemistry, a degree in pharmacology, drug development. I didn't like pharmacology. I love animals. And so I abandoned that career path and went back into psychology. So I have a master's in psych, and the IC network was my PhD proposal in psychology, how to deliver support to people who were homebound. Ironically, even though, you know, it's obviously working, we were rated #1 in the world by Harvard Medical School, and I just got published by Harvard. Ironically, I couldn't finish the degree. So I'm just a lowly master's. But anyway, it is what it is. I'm just going to say flat out, a lot of us have PhDs in IC at this point in time. Pamela, I'm going into an MRI for the pancreas. One urologist wants to do an MRI of the vagina. Never did. Never did. Not. You no longer see him. Will an MRI in the vagina tell us anything? Well, yeah, it could. It could tell if you have fibroids. Um, what was his motivation for that? What was he looking for? I mean, could show cancer maybe if you've got big tumors in your bladder. I mean, in your vagina or your uterus. Pamela also says she was on Elmeron. The eyes were worse. Have not been able to drive for years. You did the Mona Lisa. Had a biopsy on the vulva last year. Removed squamous cells. Yikes. Is this because of Mona Lisa? I don't know. My doctor asked if I was sunbathing my vulva. Oh God. Well, anybody who's ever had yeast infections, we have been known to do that. It's never a good idea. I did it once years ago in my 20s, just because my crotch was on fire and I thought it would help. But you certainly don't want to get a sunburn on your Tinder bits. Definitely not a good decision. Good decision. I think I lasted 5 minutes. But your vulva, you still have pain, raw, burning, and tingling. Girl, listen, if they found squamous cell cancer on your vulva, you need to be under the care of your doctor. Generally, we're seeing a lot of HPV-driven cancers on the vulva, in the urethra, in the vagina, and so in the meantime, I would think that they would perhaps want to give you something like a topical lidocaine cream or an Omibot cream, which is an amitriptyline baclofen. They could even do a ketamine cream. There's got to be some compounded creams that might be helpful for you. Timmy says, you just found Desert Harvest Aloe and the reviews are super good. Do you suggest it? You can certainly give it a try. We prefer the aloe path because it also has a pain fighting ingredient in it. Just understand that aloe is known for causing gut distress far more than the other ingredients. And so quite a few patients are intolerant to it. I'm one of those patients. Others can tolerate it well. So don't buy a year's supply. Buy 1 bottle and just give it a try first to see how you do. Okay. Ironically, when I started my support group here in California in 1993, the first patient I worked with was a patient who got a chemical burn from an aloe drink from China, massively contaminated drink from China. And the damage from that, there was a big lawsuit over that. So anyway, you just got to listen to your body, and see how you feel. One of the success stories that I have about Desert Harvest Aloe was a young boy who had a lot of urethral pain, and it was aloe that helped reduce some of that urethral pain. They did um, that aloe drink. Is it Mike's aloe drink? What's that? There's a company from Florida that makes an aloe drink. George's aloe drink. That's a very popular aloe drink that some patients use. And when it comes to if you want to take the capsules, Desert Harvest Aloe or Allopath are absolutely viable options. Hello, Karen from Reno, Nevada. Hello, Boria. Nice to see you. Hello, Sherry. Diagnosed 2 weeks ago and had 2 treatments of bladder installations. What else should I be doing? Well, Sherry, it depends upon what subtype you are. Oh my God, I didn't finish the subtypes. Holy crap. Okay, let's get back to our subtypes here. Subtype 2, bladder wall driven. All right, so the first thing we're looking at is chemical injury. The second thing we're looking at is estrogen atrophy. The third thing we're going to look for is chronic infection. Chronic fungal infection. Our own National Institutes of Health has discovered that some IC patients who are flaring because you have fungus in your urine. And that's probably because of the overuse of antibiotics. That's my guess, at least. And so now we're doing next generation DNA urine testing to make sure that we haven't missed a fungal infection. If you flare when you eat sugar or carbs, fungus, possibly. All right, so that's bladder wall driven. Of course, there are some other rare things, but those are the classic things that we look for in somebody who has pain as their bladder fills with urine that is relieved by urination. Our third subtype is actually the biggest subtype, and that is pelvic floor driven. So these are the patients whose symptoms began after a fall, a car accident, a history of athletics, riding bicycles, riding motorcycles, gymnastics, ice skating, paratroopers, coming out, parachuting. Yeah, those are hard landings that can rock your pelvic floor. Having a baby, being raped, a history of sexual abuse. Your muscles will directly influence organs. So if you have sustained a muscle injury, generally what happens is that muscle gets weak and then it gets tight. And it develops trigger points, which are tight bundles of muscle tissue. They're lumps, hard lumps. There are consequences to having tight muscles in the bladder, because if you've got tight muscles in the bladder, that is restricting blood flow dramatically. And it's very hard for the bladder to be healthy if it doesn't have good blood supply. So our therapeutic priority for somebody with a muscle injury is going to be restoring blood supply. How do we do that? With pelvic floor physical therapy. And again, that 2008 research study that I talked about 20 minutes ago proved beyond a shadow of a doubt that pelvic floor physical therapy outperforms bladder therapies for many patients. And that's why we now no longer think of IC as an incurable bladder disease, because for some of you, it is a curable muscle injury. The challenge is a lot of doctors don't check for the muscles, but if you can't start your urine stream right away, if you're sitting there 5, 10, 15, 20, 30 seconds before you can relax enough to release urine, you have tight muscles. If you have pain with sex, you have tight muscles. If you have a pain sitting and driving, you have tight muscles. And so we want to make sure you have a proper pelvic floor assessment. And this is really true for men. And I'm going to say flat out, at least here in my office, 90% of the guys I work with, I can find an old muscle trauma that they've long forgotten about that creates the foundation for all of this. And God forbid you have trigger points. Those are long-term compressions of nerves and muscles. So pelvic floor physical therapy and having a pelvic floor assessment, Sherry, is critically important to your diagnosis. Did they check your muscles, and are your muscles tight? If they are, we got to work on those muscles. Our fourth subtype is Pudendal Neuralgia. So think about it. So our first subtype, probably viral infection, possibly. Second subtype, a bladder wall injury. Third subtype, a pelvic floor injury. Fourth subtype, a nerve injury. So these are the patients who, when you sit down, it hurts, but when you stand up, it gets better. Or you have pins and needles on your vulva or on your skin or by your rectum. Or you have sciatica, you have pain shooting down your leg. Or if you feel like you're being shocked, that tells us that your pudendal nerve or a nerve is being tweaked, usually by a tight muscle. And so our therapeutic priority for this group of patients is to, number one, figure out which nerve is compromised. We want to try to release the restriction, which is probably going to be pelvic floor physical therapy. And at the same time, we've got to calm nerves down. So generally, this is where they're gonna give you amitriptyline, they're gonna give you Neurontin, medications that are more effective at calming nerves down, or you could try the over-the-counter supplement Peora, which might also do that to a lesser degree, but it's also a viable option. And this is where sacral neuromodulation might shine because that can help re-regulate those nerves too. So again, if you have pain when you sit down that is relieved by standing up, you have pain shooting down your legs, you've got persistent genital arousal disorder, that dirty secret y'all don't want to tell each other where you feel aroused, but it really hurts. That is a compression of your pudendal nerve. And we have got to figure out where it's compressed. And the correct therapy is going to be perhaps a nerve block to give you a relief from that pain combined with medication to calm nerves, and most importantly, pelvic floor physical therapy. That is critical here. Last but not least, I see subtype 5, which is my subtype. My primary subtype is central sensitization, and there's a new name for it, chronic overlapping pain conditions. So if you're a patient, you've got bladder pain, you've got IBS, you've got TMJ, you've got fibromyalgia, you've got things like that, that actually is now considered to be a central nervous system dysfunction. And I attended a fabulous, fabulous conference in October with the International Pelvic Pain Society that talked about that more in depth because I mean, like, I don't know about you, but like, I mean, my life has never been normal. I had frequency urgency in 7th grade, 8th grade. I had vulvodynia in high school, ovarian cysts in college, IBS in my 20s, IC in my 30s. TMJ hit in my 20s. I had migraines for about 6 months. What the hell is this, right? Because you feel like you're damaged goods. You feel like you're being punished. You don't understand what the hell is wrong with your body. Now we know. Now we know that and this is where it's kind of creepy, but then it gets better. So, um, most of the allied pain conditions got together about 15 years ago, and they created the Chronic Pain Research Alliance. And they have been studying this in depth. Why do patients get these conditions? And why is it often cumulative over time? Like every couple of years is something new, and every couple of years is something new. And they started doing brain scans. And the brain scans showed that our brains are living in fight or flight. One of the really consistent things we see in patients with chronic overlapping pain conditions, myself included, is extremely high anxiety disorder, right? Like every thought is negative. And when you look at our brains, what you can see is that the amygdala, which is the part of the brain that protects you from a saber-toothed tiger. If you opened your door and you saw a saber-toothed tiger across the street, you're going to be startled. Your sympathetic nervous system turns on, your amygdala turns on, it increases your heart rate, it increases your blood pressure, it tightens your muscles to to prepare you for fighting or flying or fleeing. It's the fight or flight response. And that's your brain's job. Your brain's job is to protect you. And so when it sees a threat, when it sees a stressor that it thinks is jeopardizing your life, it's going to turn on the sympathetic nervous system and turn on the amygdala. But normally, once a stressor has passed, the amygdala turns off and the parasympathetic nervous system takes over. And that reduces your blood pressure. It reduces your heart rate. It relaxes your muscles. So we're living in a heightened state of a fight or flight. Our brain is stuck in the on position. And so the best class that I took at this conference was pediatric risk factors. Why does this happen to some kids and not other kids? Because it started for me when I was a kid. And what they found is number one, for 80% of the kids, I think that was, don't quote me on that, but it was the majority of the kids in the year prior to the onset of their symptoms, there was a physical trauma, like breaking your leg or a bad fall. And I was working with a patient like on Friday or Thursday who had several major traumas in their childhood. Some of you have been hit by cars, fallen off of bicycles. And the challenge that we have here is that number one, we kids, we don't usually tell our parents when we fell unless we're bleeding. And God forbid you be a boy and you jam your crotch on the bar of a bicycle and your penis hurts. Are you really going to go home and tell your mom your penis hurts? The odds are you're probably not. And so kind of theory number one here is that there was a physical injury that perhaps was either incredibly traumatic or it just didn't get treated quickly in a timely way, and that amped up the nervous system, that wound up the nervous system. But the other thing that they found for 20% of those patients, and I'm in this group, is that these kids are a victim of bullying or abuse. And I've talked about this regularly. I grew up in a neighborhood where we had a kid my age who later raped and murdered my neighbor. And it was a three-striker, and he had fetal alcohol syndrome. Many of us were traumatized badly. And so I went through a period of time where literally from like fourth grade through all the way through junior high, where you better believe I was in fight or flight as soon as I walked out of my house, because you never knew where he was. You never knew where he was, and when he found you, he hurt you. And the hard part, I'm not angry at my parents, and I'm not angry at the school because he was very mentally ill. But I do think that I should have been put in another school. I don't think I should have, but we have our high school reunions now, and there's a whole group of us, including bank presidents. We were all traumatized by this. We all have PTSD. So the best way that I can explain this to you, and I've done this before, is think about a brand new puppy coming into somebody's home. Happy, 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 tail wagging, tail wagging. Oh, it's just the happiest little kid, happiest little puppy. And when your back is turned, somebody in the family kicks it, and you hear the puppy yelp, and the puppy might, cry for a second or two, and then it starts wagging its tail again. Like, okay, that was an anomaly. But the next day, it gets kicked again. And maybe twice a day, or maybe 3 times a day by a member of the family who's abusive, nobody else can see. And this goes on for 2 weeks. And at the end of that 2-week period, all it takes is 2 weeks for the brain function to change. 2 weeks of distress, 2 weeks of abuse, 2 weeks of bullying. They see changes in the brain. 2 weeks of mind-body medicine repairs that. It will repair that. This is fixable. So when we think about chronic overlapping pain conditions, what we're really thinking about is a central nervous system that has become, the word they use is maladaptive. This is not, nobody's saying this is a mental illness. This is not a mental illness. This is a brain that is kind of stuck in fight or flight, that the sympathetic nervous system isn't functioning the way it should be functioning. What's so exciting about this now, and number one, it gives us context. Number one, what I hope it does is takes all the shame or blame away. It's not your fault. You've done nothing wrong. You are not damaged goods. You are a beautiful man and woman. You're just hurt. You were hurt physically, mentally, or emotionally. You were hurt. I was hurt. I was absolutely hurt very, very badly by that. That was very hard to get over, especially after my neighbor was murdered. I still wouldn't even talk about it until I talked to the district attorney first to make sure that he wasn't around, and he's long gone, so it's okay. All right. So how do we fix this? How do we fix the sympathetic nervous system? We do it by engaging the senses. So let's think about the brain for a moment. So remember, your brain's job is to protect you 24 hours a day. And its informational input is your senses. What are you looking at? What are you tasting? What are you smelling? What are you touching? Is it hot? So your brain's job basically is to monitor your environment, and the way that it does that is by monitoring your senses. But when you're stuck in fight or flight, it's not paying attention to the senses anymore. It's just bursting, the little lightning bursts all over your brain that are focusing on the threat. So the way we break it out of that is we embrace the senses. We need sensory stimulation. And so let's go ahead and do a super easy mind body medicine technique to do this. All right, we're going to do I Spy. So I want y'all just take a breath. Let's just do it. Take a breath in, take a breath out. Let's do it again. In and out. Now what we're going to do is we're going to force the brain with sensory stimulation to pay attention to your senses. Okay? So I want you to look around you and focus on something. Like for me, I can see in my camera the roses back here. This is my mom's birthday bouquet. She doesn't know it's here. Okay. So I want you to look at something beautiful, or just look at something and just like for 5 seconds, just look at it. Just like, you know what? It's pink. It's pretty. Gosh, I love flowers. Oh, it's such a nice, lively way. Just do something like that. Okay, now let's take a nice, slow, deep breath in, out. Okay, now what can you hear? Do you hear anything in the background aside from my voice? You hear anything? And I can hear my 90-year-old parents in the kitchen rustling their papers. They're reading the paper. Okay, so just listen to that for a moment. Okay, in, out. Okay, what can you smell right now? Are there any interesting smells around you? Like for me, peppermint tea. Okay, just focus on that smell. Okay, in, out. What can you taste right now? Do you taste anything? Anything? You taste your lunch? Mint tea like me? Focus on the taste. Okay, let's take a deep breath. In, out. Now, I want you to touch something. Here you go. I'm going to touch my microphone. Touch your pants or your top or your skin, or if you have a cat on your lap, do that. Just touch it. Mine has a texture to it. My brain is now paying attention to that texture. My brain's going, what the hell is that? But it's not threatening, but it's interesting. So my brain's thinking about that. Okay, in, out. Okay, now we're going to do the fun part about it. Now they're going to do the really fun part about it. Okay, what could you look at that would always put a smile on your face? What would it be? And for me, it would be a butterfly flying across my window. Okay, so think about that for a moment. God, aren't the butterflies are gorgeous. Okay, in, out. What could you hear that would put a smile on your face? A puppy barking? Music? Somebody talking in the background? For me, I remember I used to love to listen. I would lay on my mom's lap in church, and I'd have my ear to her chest, and I'd be listening to the vibration of her singing. I loved it. Okay, in, out. Okay. What could you smell? that would put a smile on your face? What would it be? For me, it'd be coconut. I love coconut or lavender. Now we know why essential oil therapy is good because it's forcing that part of the brain to pay attention to your smell sense. Okay, in, out. What could you taste that would put a smile on your face? Cinnamon roll, hands down, bam. Or, back in the old days, a coffee frappuccino or a latte. Okay, in, out. Okay, what could you touch that would put a smile on your face? What could you touch? Petting your dog, your cat, caressing the cheek of your lover? Think about that for a moment. Imagine you doing that. Okay, in, out. Now, remember what this is doing is this is mind-body medicine. This is physical therapy for the central nervous system. It is forcing your central nervous system to turn off the fight or flight and turn on normal functioning. And that's critically important here. One of the things that happens with somebody with chronic overlapping pain conditions is we live in anxiety. And that's just because the sympathetic nervous system is stuck or in fight or flight. I mean, your brain legitimately thinks your life is in danger. Of course, you're going to be anxious. And so it's so incredibly important to address anxiety and learn anxiety management skills. And I think that that's what turned me around is about 20 years ago, I was just sick of having a panic attack before I went to the doctor. I was sick of it. I'd be crying in my backyard 45 minutes before the doctor's appointment. And one day I just went, enough, I'm done. I don't want to do this every time I go to the doctor. And so I signed up for an anxiety management class at that hospital. And it was effing hard to go because I was afraid to go to the doctor. I was afraid to go to the hospital because of this. It was hard, but I did it. I walked in. And you know what was so cool about going to an anxiety management class is you walk in and you see normal people. And then you come to realize, you know what? I'm a normal person too. Of course, anxiety is real. In my anxiety management class were the first lotto winners in the state of California. They got anxiety because of the threats they got because of the lotto. And that's one of the great gifts about going to a support group meeting is you get to meet other people and you come to realize that you're not different. You're not the problem. That normal people have this. There's nothing abnormal about you. You're just hurt. And that context is really, really, really important. So in our Winter magazine, I did a huge story on this, and a huge, huge story on 15 pages. I think the most important story I've ever done for the IC network. And where is it? Where did I put it? Oh, here it is. So if you have chronic overlapping pain conditions, come on over to the IC network and buy this issue. Buy this issue. I think that you will find it stunning. And again, it takes all the guilt away. It takes all the stress away. It's like, oh, okay. I get it now. I totally get it. Never my fault. It's not your fault. It was never my fault. We were hurt, but we can heal. So I know that it's, listen, when my urologist told me early on, he's, very first appointment, he said, I need you to get this book on mindfulness. And I was like, don't talk to me about mindfulness. I don't want to listen to that crap. My bladder is screaming at me. Help me with my freaking bladder. And I didn't understand. I really didn't understand. I just thought I had all these weird things happening. I didn't see the connection. And he was right. Because of my history, because I had IBS and vulvodynia and IC, he saw first on, yeah, you have a central nervous system that is not functioning correctly. I did not get it. I did not understand that until much more recently. And that is even with a master's degree in psychology. Okay. So anyway, this is super, super, super exciting. Now, because there's hope. And I'm better. I don't live with pain every day anymore, and I haven't for years. Because my number one, I've taught my brain through with a really good anxiety management class. I don't let my central nervous system get wound up, even through uterine cancer and emergency surgery. Bam, I didn't have a single panic attack. I've not had a panic attack since I took the class. It's amazing how much calmer you are when you get rid of the adrenaline and we work on stuff. So I have a great video on our website about the anxiety management class that I took. ICnetwork.org. Go into our Living with IC video series and please watch that video. Now, where is it? Here it is. I'm going to try to get this for us. So one of the crazy games out there is called whoops. Whoa, oh darn it. Hold on. Okay. For those of you who like to game and you're fairly shameless like I am, a hysterical game is called Cards Against Humanity. Absolutely hysterical. I love playing it. Yes, Oksana, there is. Every meeting is recorded. The quality isn't so good with the recording, but the voice is good. The video is not so good, but that'll change next week because I'm bringing in a new video system. So anyway, I found this. Cards Against Anxiety. And I'm going to bring this into the IC network. I'm just starting it. And it's all sorts of tips on just different ways of looking at anxiety, right? Like, here's something that might surprise you. And this is something that I learned at the International Pelvic Pain Meeting. One of the best things that you can do is so let's say you work in a job and you're bullied or you just feel insecure, right? And you called into a meeting or you have to make a presentation or you're in school and you've got to speak to the class and you're freaked out. One of the best things you can do is the Wonder Woman pose, right? So walk into work, just in your legs apart, hands on hips, head high, Wonder Woman pose. And do you know, when you do that, your brain changes for the better. You get an increase in testosterone, if I remember correctly. I talk about it in the magazine article. What they found with the Wonder Woman power pose is that because it increases testosterone and because it will increase your confidence. And so as you walk into that meeting or into that classroom, you're prepared to fight. You're confident, all from a body pose. There's this great video on a TED Talk about that, and I have a link to it in the article. And we should play that. We should play that one time in our meetings because it's so good. Your body position matters. If you're like this all day, and if you're in meetings like this, and you don't look people in the eye, that changes your brain chemistry for the worse. But if you're in the power pose like this, and you're looking people in the eye, your testosterone level rises, and guess what? You're ready. So anyway, one of the things I liked about this is they had these cards that came with it. And so some of the techniques in here are hysterical. I thought I would. Well, look at here it is. Here it is. There's a Wonder Woman pose right here. Stand up straight. Okay, dissing yourself. Imagine negative self-talk is coming from a bad-tempered parrot squawking in your ear. You're nasty. You're not a nice person. Then take aim and shoot him off your shoulder. I love this one. Rather than worrying right now, make a decision to do it later. Scheduling your worry is a way to give yourself permission to relax into a worry-free present. That's what I say about anger. Man, it's okay to be angry, but you don't have to be angry all day. Pick a time. You're gonna be angry? Okay, 9 to 9:30 in the morning. That's your anger time. Get it out. Scream in the shower, hit your pillows. That's your time to be angry. And when 9:30 is over and when it's reached, you're done being angry. Now let's move on to the rest of your day. Sherry said somebody told me the power pose looked aggressive. Yeah, I bet it was a man. And I don't mean to offend any men that are watching this right now. Hun, tough. If they think it's aggressive, that's fine. Oh gosh, these cards in here are so awesome. Oh, here's something easy. Rate your anxiety on a scale of 1 to 10, then set a timer for 1 minute. And then remember all things pass. After a minute, rate your anxiety again, just by doing deep breathing. Move your body and move your anxiety along. Find a bigger space and start pacing. Really feel the sensations in the soles of your feet. Go as fast or slow as you like. Anyway. These are cool. Let the calmness flow in and the anxiety flow out as you slowly drink cold water. Focus on the feeling. When I was a kid, so I had really, really painful period. My period started in 4th grade. 4th grade. Can you believe it? 4th freaking grade, my period started. And the cramping was insane. And so I would be in the bus driving to school, and I would close my eyes and I would pretend that the pain was going down my legs, going into the floor of the bus, then it would reach the wheels, and as the wheel turned, my pain would be out on the street. And Donna says her period started in 4th grade too. Yeah. Hey, girl. We're special, hey? But that's pretty good for a 4th grader to I was actually doing a visualization and it worked. And so anyway, okay. Well, listen, obviously I can talk forever about this. Now listen, guys, on Facebook, I have missed a lot of your questions because it scrolls through so quickly. And frankly, I'm talking my ass off right now. Sorry about that. What I'd like to do is start the Zoom portion of the meeting so that you can come in and talk to me. And we'll do some coaching, some live coaching. YouTube and Facebook will be open. Rhonda says COVID was horrible on my bladder. Right. Can I do caffeine-free Diet Coke? No, 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 no. Can I hear collective from everybody in the room? No, you cannot drink the Diet Coke. No. If you had an open wound on your hand, would you pour Diet Coke on it? No. No Diet Coke. Why? I got the acid of the Coke combined with the extreme acid of the artificial sugar. And so it's a double whammy acid bomb when you drink a diet soda. No, absolutely not. Courtney says, are glomulations the same subtype as hunters? No, they aren't. In fact, glomulations are no longer considered meaningful. A glomulation means that the bladder wall has been damaged, probably by the test. We used to think this was IC. Now we believe that this is the result of the test itself. All right. I want to go. We can come down here to YouTube real quick, and then we'll turn on Zoom. Nicole says, your work with this organization, including videos and the website resources, have been more helpful than any specialist I've been to. Thank you for being so authentic. It's refreshing. One of the most valued pieces of advice I took away from listening to several of the older support group videos is that it is our responsibility as the patient to understand our condition, and we must be our own advocates in seeking out treatment and not to just assume that the doctor or specialist you're seeing has all the answers. That is so true. Nicole, thank you so much for your very, very kind words. You nailed it, girl. Hey, man, listen, we pay them, they don't pay us. We're the boss. We're the ones making the decisions. All right, let me go ahead and start the Zoom portion of the meeting. I'm 20 minutes late. Sorry. So the way to get into the Zoom meeting is you can just go on over to our website, icnetwork.org, click on the support pull-down menu, go to the second link that says streamed support meetings, and the Zoom meeting link is right there. So that's what I'm clicking to actually launch the meeting. The meeting is open, and now let me invitation to the meeting. Holy moly, you never know. My gosh, all right, hold on. Copy invite link. It is now copied. All righty, hold on a sec. All right, Facebook. My mouse is dying on this computer. Facebook, there is your invite. Now I got to find YouTube here. Hold on, YouTube. All right, YouTube. Here is your link. There you go. So when we do these meetings, when we do Zoom, this is where you get to come in and ask questions, right? And you can tell, but understand that number one, it's not confidential. Obviously, there is an audience who's going to be listening to it. And at the same time, your voice is recorded and will be played back. So please don't put anything that you don't want the public to know. Don't say anything there. Your pictures are not saved. Here, hold on a sec. I'm like super hot, so I got to get this hair up. All right. Woo. That's where my hair should have been from the first minute I started this meeting. All right. So I'm going to let Suzanne in, iPad in, whatever your name is. I know it's not iPad. So let's just give it a minute or two. If you need to take a potty break, this is a great time to go take a potty break. It's one of the best parts of doing support online is y'all can go to the bathroom whenever you want. You don't have to worry about it, right? I'm going to let Debbie in. And I know the Super Bowl is probably starting soon too. All right. Let me just have a couple more bites of yogurt. And here comes Patty. All right. So what we're going to do, guys, now is we're going to probably for the next half hour, we'll be working in Zoom. So for those of you watching on Facebook and YouTube, please know that I'm not necessarily going to see any comments. I try to pay attention to it all, but it's quite hard. And in Zoom, guys, please keep yourselves muted until I call on you. All right. Hello, Debbie from Gulf Shores, Alabama. Very nice to see you. Suzanne says, thank you for all you do. I've learned so much, especially with being my own advocate. Happy to be an IC Network sponsor and looking forward to receiving some products. Awesome, hun. Hey, man, we're in this together, right? We are in this together. That's a blessing. That is the blessing of support groups. Kristen said, would cards against anxiety be appropriate for a teenage girl? You know, I haven't finished it, but I think that if you get it, I think you need to look at it first and see what you think. I'm not seeing anything that's scary in it. I mean, they're just classic. I mean, would have I liked some of this as a teenager? I probably would have rolled my eyes because I wouldn't have necessarily understood the science behind it. But you know, we all need good anxiety management skills. God didn't give us the skills to deal with the life we have. We, you know, when we're born, babies don't know how to deal with pain. We have got to learn those skills. We got to learn those anxiety management skills and all that sort of stuff. So learning skills is important. All right. So for those of you on Zoom, please don't take it personally if I don't call on you first. I'm just going to do the best I can. And I'm going to go first with Mama Fitz. Hello. How are you today?
I'm pretty good, thank you. It's really nice to talk to you. I've watched lots of your videos and they've been so helpful. What you do is amazing.
Oh, thank you. Well, how are you doing? I mean,
yeah, I've had IC for decades now. I've also got fibro, endometriosis, and had adenomyosis. Just been diagnosed as well with EDS and bowel prolapse and intussusception.
Okay.
So I've got lots going on.
Yeah.
But at the moment, I'm having real trouble at night time going to the toilet. And it's not an issue I've had before. I've always got retentions. Whenever I've had scans done, there's always been retention in the bladder.
Mm-hmm.
And also I have a really slow flow. I go lots and lots of times. Nighttime is awful. So I'm up probably, I think, 3 to 8 times a night.
Okay.
But at the moment, when I go to the toilet at nighttime, there's just literally a trickle coming out. Sometimes it's just drip, drip, drip. And I don't know if it's the bowel prolapse or if it's an IC thing, but the doctors here in the UK are just not great with IC.
So, okay. So given that you have other pain conditions, we automatically are going to put you in the chronic overlapping pain condition group. And you said, and you got, and bear with me here, you said that you had endometriosis, correct?
Yes, yeah, widespread endometriosis. I had a hysterectomy 2 years ago.
Okay.
And unfortunately, that caused a really bad IC flare-up, and I actually had sepsis because I had an infection from the surgery, which went into my kidneys and then caused sepsis. So I was really ill afterwards.
So, the case study that they used at the International Pain Conference was you. It was a woman who had painful periods as a teenager. Then she had endometriosis, and then every few years she got a new pain condition. And they use the same woman for 3 weeks because that's the classic setting. So why does that happen? We have to remember, number one, that when you're in pain, your brain thinks your life is in jeopardy, and that is absolutely engaging fight or flight.
Yeah,
and
I can totally agree with that.
Right. And one of the consequences of being in fight or flight is your muscles become very tight.
Yeah.
So let's think for a moment about what's happening to you at night. So you're getting up 3 to 6 times, 9 times a night. You feel like you need to pee, but when you go to pee, nothing's coming out, or you're just getting drops. And so I have to wonder, number one, if you're actually having a muscle flare. I have to, you know, I kind of had this like 2 weeks ago. I don't remember what trip, but I have been doing a lot of pelvic floor work, and I have noticed now that instead of being Miss Drippy, I can pee. And you know, it's kind of going from one extreme to the other is weird because you realize you're peeing comfortably in a long stream, and you think about being in a public restroom and the person next to you comes into the stall and they're peeing like a horse, and you're there dripping.
Yeah, I sit there and listen,
right.
and I'm like, how do they pee like that?
I know. And you and I are sitting there, we were sitting there, drip, 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 drip. I really honestly think muscle tension has a lot to do with it. And so it would be fascinating to test that theory with, number one, have you had a pelvic floor assessment? Do we know what's going on with your pelvis?
Yes, and I've got my own facial trigger points. And because I was waiting to get them, that's all internally.
Right.
She thinks I've got them mentally as well, but because I was still waiting at that point to get the results of the bowel issues, she said she didn't want to go any further, and that was just left. I mean, unfortunately, lots of doctors have just kind of not done anything with me. I've been left for years with all these various things. I mean, it took 16 years to diagnose the endo. So
right. So you need this book. Oh, okay, y'all know. Now y'all know. I say this every week. It's not a real support group meeting if something doesn't fall. It happens all the time. Hey, man, we're just lucky it's not an earthquake. I actually did 2 live icy events, and we had big earthquakes. Okay, girl, you need this book, Breaking Through Chronic Pelvic Pain, and it's free on Kindle Unlimited. So get it on Kindle Unlimited.
Love it.
Okay. Chicken versus the egg, cause versus effect, which comes first? That's your challenge. That's your challenge here, is your muscles are involved and your bladder is involved, your bowel is involved. What are the common connectors here? And the common connectors here are going to be muscles and nerves. And so what he talks about in the trigger point chapter of this book is that as long as you have trigger points, those muscles simply cannot be healthy. And more importantly, the proximal nerves next to it also are not going to be healthy. And he's got a great picture in here, and I want you to look at this picture. So here's a trigger point. So it's a bundle of muscle, and you can see what it's doing to the blood vessel underneath it.
Yeah.
You have ischemia, oxygen deprivation, because the trigger point is preventing the blood flow from flowing freely. And the other consequence, so here you can see it again. And so Dr. Weiss in this book is just crystal clear. As long as you have trigger points, you will not have healthy musculature. The other challenge that happens is when you suffer a compression injury like that trigger point, is you're also depriving the nerves of blood flow. And the nerves, for the nerves to function normally, they have to have a good healthy blood supply. And so the fact that you have all of these pain conditions, completely predictable, makes total sense. And I'm sorry that happened to you, and it happened to me too. So you're not alone, and it happens to millions of women. There's kind of with central sensitization, what they say is you can't leave something hurting. We have to address everything that's hurting. So if we have a painful bladder and a painful bowel, and we've got bites on our arm, and we've got whatever, if you leave the bites, if you only focus on your bladder and your bowel and you leave the bites hurting you, your nervous system is always going to be wound up.
Yeah.
And so I think you're going to be trying to focus on each one so we know we haven't missed anything. But at the same time, you have to work on winding down your central nervous system. Okay, let me ask you a question. When you were a kid, were you bullied?
Yeah, I've had a really traumatic childhood. I was abused, all through my childhood. So
right,
makes sense.
Right. And we never really, we had research studies about that years ago, and it didn't really make sense. Now we understand the context of why some IC patients, not all, but some of us have been the victims of abuse. And And again, you didn't do anything wrong. None of this is your fault in any way, shape, or form. But your central nervous system got stuck in the on position, and we've got to wind it back down. And luckily, mind-body medicine works beautifully. So I guess the point that I'm trying to make, and I feel like I'm wandering all over the place here, is you got to work on your muscles. We want to try to deal with any muscle dysfunction. If your bowels are an issue with IBS, you're going to have to do the right fibers, and let's figure out the foods that are your triggers, and let's avoid those, and let's try to get the bowels stable. For your bladder, we want to make sure you're not doing anything that's neurostimulatory that turns nerves on. So no caffeine, no chocolate, and, play with that diet a little bit to see if we can get the bladder to calm down. And then if you've got sensitive skin like I do, I have to wear my shirts inside out at night. You have the same thing?
Yeah.
Do you have
I've got sensory processing disorder as well, so everything's firing off all the time. My whole body is reactive and in fight mode all the time.
So the the thing that's just so baffling is if you look at you and you look at me, there's nobody can see this.
No.
Nobody can see. We look completely normal, and we're not abnormal. We're just injured. We're just hurt a little bit.
Yeah.
And so the last piece of this puzzle is just going to be really embracing some good anxiety management skills and working on day-to-day, keeping your nervous system calm. You're already adapting to that. I'm sure you don't have chemicals in your home, right?
No.
Nobody smokes in your home.
Oh God, no.
Right. And so you're doing everything right. Now we just got to put it together in a really good cohesive package and understand that. So what the brain studies show is 20 days of bullying, 20 days of abuse will put you into fight or flight. What the studies also show is that 20 days of mind-body medicine will bring your brain out of flight, and you will immediately see an improvement in how the central nervous system is functioning. So make a commitment every single day to do some good anxiety management, do some deep breathing, do anxiety, and let's see where you are. Bring some positivity. Bring some positivity into your daily life too, with respect to affirmations and stuff like that. Okay?
Yeah, that sounds great. Thank you. I've got leukocytes in my urine all the time and have done for a long time. Is that part of the subclass 5? I can't remember what they're called.
Well,
sorry.
You've got multiple things going on. Listen, you're going to be my subtype. You're IC subtype 5, but you're also IC subtype 3. You've got tight muscles. You've got trigger points. You're there. And because you have tight muscles and restricted blood flow, your bladder wall is not going to be as healthy. So you're going to have bladder wall sensitivity. By the end, it's chicken versus the egg, which comes first. So for us, really what came first was the muscle stuff with the bullying. And so, you have to follow the diet. You've got to protect your bladder and understand that healing is always happening. It just doesn't have good blood supply to heal as well in a timely way. So we get those muscles worked on, the bladder's going to get lots of perfusion with good oxygenation and good nutrition. So we should see a good response in your bladder too.
Thank you.
Make sense? Well, listen, hon, I'm so glad that you joined us today. And I hope, listen, you guys are living in interesting times in England. And
what's up with autistic children as well is fun.
Oh boy, are you a member of the Bladder Health UK group?
Don't think I am actually, no.
So you originally had you had the United Kingdom IC support group, UKICSG. Then they changed their name to the Cobb Foundation, which was the Cystitis and Overactive Bladder Foundation. And then 2 years ago, they changed their name to Bladder Health UK. And they have historically been a fabulous group. Really, I have nothing bad to say about them. I've flown to England twice and had an opportunity to be with them. And use their resources. They've got good resources, and they have a nurse on staff that you can call. I think 1 or 2 days a week, they have a medical professional available by phone. Okay.
That's really worth knowing. Thank you.
You're very welcome. All right, hon. Thanks for joining us.
Thanks. Take care. Bye.
Bye-bye. All righty. Who are we going to go to? Let's see. iPhone V. iPhone V. I don't know what your name is because you put in that you're. Oh wait, hold on. Did I just lose somebody? Okay, iPhone V. iPhone V. You're in a red shirt, sitting there on your couch, wearing. You've got a red. Yeah, you. Okay, let me unmute you. There you go. Okay, hold on. You're not unmuted yet. Can you unmute yourself?
Let me work it. Sorry.
Well, listen.
Okay. Hi.
How are you?
I'm still suffering back and forth with the yeast. I was, and on top of it, my psychiatrist or psychiatric nurse, she took me off of my anti-anxiety medications, with only a 2-week titrate. And I'm really upset about that. But anyway, that's not helping. I'm getting chronic headaches now. But can you tell me, you said you had a situation you had yeast for 2 years.
Mm-hmm.
How did they end up solving that problem?
So I developed a drug-resistant Candida glabrata infection after 3 to 6 months of using Augmentin, following the old Dr. Paul Fugasato IC protocol back in the late 1990s or somewhere back then. And it was exacerbated by the fact that I was sitting on a heated chair cushion here in my office.
Oh, yeah.
I loved heat. I still love heat. And ironically, that tells me, if we even go back then, that I was all muscle back then. It were really, really muscles were driving me, and my muscle dysfunction was driving my symptoms. So anyway, so I ended up getting a heat-induced, very severe infection of Candida glabrata on my vulva, on my skin. So most important thing is you have to stop feeding it. It's like making yeast bread. You give it warmth and you give it sugar, it's going to grow and bubble. And the most important thing for me, honestly, was losing. I didn't eat spaghetti for 2 years. I don't eat much candy anyway. I was eating carbs and bread and sourdough bread and things like that. I had to stop all that.
Yep.
But the thing that really flared me was milk sugar. So
I had to stop.
Ice cream, just holy hell. I mean, within 24 hours, I'd be crying my eyes out with this yeast infection bubbling all over my skin down there. So that was critical. And then the mistake that I made is that when they gave, so I never did 1 or 2 days of diflucan. And if you look at the drug information sheet that comes with diflucan, it's very clear. And it says some fungal infections require a week-long course, not just one night, a week-long course. And so we did that, I think, 4 times over 2 years. But what I did not understand, I was thinking that the genesis of my yeast infection was internal. And so I was thinking that the diflucan would catch everything. And it wasn't, because the bulk of my infection was actually deep in my vulva. And I did not use the nystatin cream they gave me. I simply did. It's a topical antifungal. Whenever they give you diflucan, they usually give you a little tube of something to use on the outside. And I never used it because nobody told me that it was on my vulva until the last big appointment. And then the last big urgent care where I was bawling my eyes out, he goes, "I can see it everywhere, Jill. It's everywhere on your skin." And And he goes, didn't you use the topical? And I went, no, I thought the diflucan was enough. He goes, no, it wasn't. There's not enough blood supply on the vulva to deliver enough of the medication to kill the yeast. That's what he told me. So we went back to using a lot of topicals. Nystatin, triamcinolone creams were what really helped me. Okay.
I don't know if you like told about Super Bowl today. I don't know if you saw my text over there from YouTube, but there's a Tom Brady. He's on this incredible diet where it's totally all anti-inflammatory foods. I mean, no inflammatory foods, no milk, no yeast. No flour, no white flour, no sugar, no nightshade vegetables.
Yeah.
And like everything's anti-inflammatories, and I guess that's one of his main big secrets. But that you can look it up on on Google or whatever. But I saw they were talking about it, and they were even talking about it on Sunday morning today.
Well, so there's no doubt that our diet today, industrialized processed food, is not healthy.
Oh yeah.
I think the old story about, why were colonics popular in the 1920s? And the answer is really interesting. The answer is that back in the 1800s and the 1700s, only the rich could afford to pay for grain to be processed. So only the kings and queens and royalty had access to white flour to make white bread. And they had a ton of problems. All of them were dealing with, and remember I want to say the kings of France and the kings of England, they saw people while they were sitting on the toilet and they had a staffer to wipe, because they were dealing with constipation day in and day out all the time, because they thought that white bread was purer. And it turned out the peasants who couldn't afford white bread were not sick at all.
Right.
And then unfortunately in the early 1900s, they invented a processing, or the late 1800s, they invented more affordable grain processing. And all of a sudden white breads were now achievable to the peasants. And so what happened? The peasants all started getting sick. They all started having bowel problems. And then, of course, we had the cereal companies, so we have the Wonder Bread, and they quickly realized that they were taking all the vitamins out. That's why bread became fortified, but they didn't put the fiber back in the bread. And so anyway, I watched a food documentary that went through that.
Are all yeast a problem? I mean, any kind of breads, usually I gotta stay away from that. So even pumpernickel and stuff like that. Breads like that.
No, I eat Ezekiel bread. I eat bread that's made from real sprouts, and it's made by a company called Food for Life. And yes, I cheat and I eat cinnamon rolls whenever I'm under stress, and give me anything that's hot and cinnamony and I'll go for it. But it's not healthy.
Yeah, I can't tolerate cinnamon, but yeah, I know. I had an M&Ms yesterday, and then now I'm suffering big time.
Oh yeah,
yeah. So it's like that. That's my. I'm like, I can't have alcohol. I can't have it nice, to give me a morale boost. So then I break down to sugar, and but Tuesday I'm getting another injection for my bladder. So hopefully, but still I got to worry about the yeast. So I guess I should.
Well, we should. Okay, so number one, let's put this in context. You know what it is. It's yeast. So there's no mystery. You have had a long-term candida infection. And so I think that book, The Yeast Connection, is a fabulous book. I would get one of those and start looking at some of the other suggestions that they have. It's not scary to me anymore. I know what it is. It's okay. There's no mystery. I'm not dying of cancer. There's nothing like that. It's just a freaking yeast infection because I took antibiotics and created the environment. And so you said I now have to worry about the yeast. I don't. I would like for you not to worry about it. The pain generates the worry when yeast is flaring. It hurts like hell, but you've got the tool.
Yeah,
You've got the tools.
right.
And so
It's just
say that again.
It's the willpower to stay away from the stuff that like feeds the morale, the that boost.
I mean, and that's why this is such a devastating time. If we didn't have COVID and we weren't dealing with all the stress of the last year, we would not have been turning to the sweets. You would be out walking happily. But even going out and taking a walk sometimes is kind of freaky if there's a lot of other people walking without masks. So I think that all of our stress levels are pretty high right now, but we're getting there. Things are calming down. You just got to start instituting a good daily self-care, trying to get a little bit of exercise in your home, maybe getting some weight. I prefer to walk on my street, which is a court, because I don't pass a lot of other walkers or runners, and I can walk up and down my street 20 times.
I love to walk, but there's 2 feet of snow outside right now.
Oh, yeah. There you go.
But they took me off the antidepressants, and I have this constant headache, so that's not helping. And I have no desire to do anything except just like veg out and hope that I can doze off for a minute.
Well,
so
why don't you cook something? Why don't you make some homemade soup? You have any meat in the freezer?
Oh, I've done that. Yeah, it's just I'm like I have no motivation. I'm just so my head's so.
Well, you have a headache right now. Yeah, you're gonna have to ride it out until your headache gets a little bit better. Listen, nobody expects you to do big giant things right now. Do little things. Sometimes it's an hour by an hour. If you can do one thing, in the next hour that might make you feel better, what would it be? A heating pad?
I can't. I'm afraid to do the heat, like you said, for the yeast.
Well, you can do the heat on your belly, just not between your legs.
Yeah. All right. Okay.
Okay. Or Lisa right here says a sun lamp. That's
I used to go. I went 1 year. I went for. I'm sorry now, but I went to for the you go into you get the sun tanning. And I didn't have any for that one winter. I didn't have the sunlight deprivation, and I noticed my attitude was a lot better. But the skin, the trade-off was I don't know, not worth it. So
yeah, I get it.
The sunlight.
Well, listen, you can do it. You know what it is. There's no mystery. It's going to take a little bit more time for the headaches to go away. Let your doctor know, let the nurse know that you're having this side effect. Maybe there's a different way that they can do it, or maybe they can titrate it in a different way down. Or, maybe they might have another option that might give you a little bit more relief. So pick up the phone, call them tomorrow and let her know. Okay.
What do you mean, about my head or about my body?
About your headaches, about the headaches.
Yeah, I'm trying to.
Okay.
She's not being very sympathetic. I think she's in a bad mood because of the election. I don't know.
Well, no, but everybody's in a bad mood right now. I mean,
I'm in a very conservative region.
But and listen, we all got to give our doctors and our nurses a free pass here, because we have no clue what they are living with every day with COVID. It's so bad for them. So many have died that I'm absolutely willing to give any doctor a free pass if they are cranky and irritable, because they have every right to be with what they're going through.
Everybody's in a bad mood. They all got a chip on their shoulder around here.
Well, but it's
everywhere.
But it's real. It's a legitimate resentment. You just spent 12 hours in an ICU, and you're driving home, and you see people in a restaurant not wearing masks, and you're just saying, please save my life. Please wear a mask. So anyway, well, listen, hon, big giant hug to you. Thanks for dropping in.
Thank you.
Okay. All right.
Take care. Stay safe, Jill. Bye-bye.
Thank you.
Thank you. Bye.
Let us go to Patty. Patty, can you unmute yourself? There you go. Hey, girl, how are you today? How is life?
Oh, it's all right. Like I said, I'm recovering 1 week out from my hysterectomy.
Oh, that was you. Oh boy.
Yes, that was me.
Are you?
Before I get to it, iPhone V for your you said you were off your antidepressants. Have you tried ashwagandha?
Oh,
it's a stress and mood herb. Like I was on Zoloft for depression, but it was like tanking my blood pressure. Like my blood pressure was so low every time I stood up, I got dizzy. And my doctor said to get this. This is over the counter, and it did work. I don't know if it'll help for your headaches, but maybe ask your doctor about that.
Ashwagandha.
It's ashwagandha. It's a mouthful. It's ASHWAGANDHA.
Ashwagandha.
For stress and mood, and it helped me.
I just put it in the chat window, but I don't think I got the spelling completely correctly, but that's pretty close.
Yeah. Well, that's the name of it.
Yeah. Yeah, these headaches are driving me crazy, and I don't want.
So look into that. Maybe that'll help you out. So
that's a good idea.
Thank you very much.
I used to sell. Yeah, I used to sell it in the IC Network store too. We just didn't sell a lot of it. So, all right, Patty, how are you, hun? How is life today?
I'm doing good. Like I said, slowly recovering. My hysterectomy didn't quite go to plan because everything was. My doctor said they were cemented together.
Oh my God!
She was like baffled at how I was living. Like
I want to know.
Said, well,
are you walking?
I wasn't really living.
Are you walking like this?
Oh, not too much. I mean, a little bit right now because my bowels are not happy with being manhandled so much, so they're protesting.
Yeah.
But yeah, I'm feeling all right now. It's just I kind of want to just come on here and personally thank you because these meetings and this group is kind of what led me to this path. And honestly, I think if it wasn't for you, I'd still be like spinning my wheels doing the diet and not realizing that it's not my bladder, it's something else. So
yeah.
Thank you so much for these. Like
you are very welcome.
You gave me hope.
Well, and
I saw now I have a light at the end of the tunnel.
Well, and so what was so important in your case is that you had no clue that you had you basically had endometrial adhesions connecting your bladder and bowel. You had no idea, right?
No.
And so it's good. So it's going to be very interesting to see how your recovery goes. I mean, like you're right. You had a major bowel issues going on. I mean, with the surgery, and it was very tricky for him. It took him 3 hours to do the dissections and to separate everything. Did he say anything about what to expect with your recovery? Did he? Because you haven't had your post-op visit. You're not going to be there for another couple of weeks, correct?
Yeah, next week is my post-op.
So okay, so what would I be asking him then about that? Let's think about that for a moment. I would want, number one, did they take pictures? Normally they take pictures of everything.
Yes, she said she took a lot of pictures and she was going to show me them.
Oh, good. I hope you'll get copies so that you can show them to us.
Yeah, I want copies too.
Yeah, because I lost my copies of mine. They are somewhere in my files. I can't find them. So I would want to see pictures. I would want her to explain more about what she found and where it was. So yes, it was on your bladder. Yes, it was on your bowel. Was it also on a ureter? Was it around your urethra? Just to get an idea of the landscape and the anatomy, right?
Yeah, the left ovary, she said, was pretty much fused to my fused too, and she just ended up taking that up with it. You know, she decided it wasn't worth trying to separate. I still have the right ovary, but the left one's gone now.
Oh, thank God. You could be a new woman in a couple of months. You just got to get through your post-op recovery. I know, but I really hope as time goes on, you're going to see a dramatic change in your symptoms. Our challenge here is you're still post-op recovery. So are you still using, I was using pain medicine a week later. Are you still using your pain medicine?
Yeah, but the pain's honestly not too bad. So I've been okay with Tylenol. I mean, they gave me
Wow.
some hydrocodone, so
Okay.
and some Norco, but I haven't had to take much of that.
Really? Wow.
Yeah, I'm kind of surprised at how painless I've been feeling. Like I said, it's just my bowels just
Oh yeah.
me right now.
Oh, hey, listen, no, I mean, trying to have a bowel movement after a hysterectomy, there's no pushing, right?
Yeah,
You
exactly.
cannot push. You just have to wait for your body to do what it needs to do. I finally at like day 5 or day 6 did a fleet enema to move things along because I could feel that I needed to go. I just couldn't go. So, and the fleet enema just kind of moved things along. So, well, hon, you look great. I'm glad
Thank
it's
you.
over. And now we
Yeah,
have
me
some
too.
clues. Now we at least have some clues. So with any luck, again, a month from now, 2 months from now, you could be stunningly better. And I really hope and pray that that is the case for you.
Yes, well, I definitely will keep everyone updated. And like I said, thank you so much for these meetings because they were a lifesaver.
Oh, I'm so glad I could help, hon. So glad I could help. Good luck.
Thank you.
Okay. All right. Sharon Tucker. Hello, hon. How are you? I have to unmute you. Can you unmute yourself?
Sorry. Hi. I had a question. First of all, I was really bad because I started thinking, well, maybe this is all stress related. Maybe this is all psychological. And I've always loved chocolate. I've been it's like an addiction. So I just binged on cocoa, and boy, did my bladder, I mean, oh my God, it just proved to me that it's not just all these doctors that want to make you think it's all in your head and it's all psychological. And all it takes is for you to eat like some of the forbidden foods, and then you say, no, it's not just psychological, because if it was, I could eat all the chocolate in the world.
Right. Right.
But my question for you was, I was reading about bladder training, because with me, it's not pain. I don't really have the pain. I have the frequency, urgency, and like difficulty with the stream. But what is your opinion for people who have urgency? Not like not urgent. I'm sorry, I said it the wrong. Not urgency. I mean frequency. Not urgency, but just a sensation of constantly having to urinate. And even after you go, right after I go, I still feel like I have to urinate again.
So frequency urgency is coming directly from the alpha afferent nerve in the bladder wall. That is meant to be easy to turn on because it works 24 hours a day to tell you when you need to pee. Okay. So whenever something is happening with your bladder, the first nerve that gets turned on is the alpha afferent nerve, and the last nerve to turn off is also the alpha afferent nerve. So what that tells me is that I would be expecting, number one, that there would be some sort of neurostimulant or something that's creating an environment for the nerve to be injured. And girl, coffee is chocolate is neurostimulatory.
Right.
It is extremely neurostimulatory. And so if I eat chocolate, I get what I call bend over and screamers, such severe pain that I'm like in the fetal position for 2 days until that chocolate leaves my body. Once I get rid of the last bit of whatever the metabolite is, and when it hits the left hip bone, that last part right before your rectum, those spasms are agonizing. So I would look, number one, do you have estrogen atrophy? Number two, is there a neurostimulant in your daily life? Are you doing coffee or tea or chocolate, something like that? And then because the bladder can be a secondary victim of another dysfunction, I would still want to make sure that you've had a pelvic floor assessment, and let's make sure tight muscles aren't part of the problem too.
Yeah, well, I was diagnosed with pelvic floor dysfunction.
Okay.
But
Oh,
because I do have pain with intercourse and stuff like that, but mainly it's the frequency. Well, I guess what I was asking is I was reading about bladder, they call bladder training, where you can, like, when you feel the sensation of having to urinate, you try to psychologically say, no, I know I feel the sensation that I have to urinate, but I'm going to sit here in my chair and I'm going to try to ignore it.
Well, it's called timed voiding. And so if you're peeing every 10 minutes, they say, okay, go 12 minutes. After you do 12 minutes for a day or two, they say, all right, go to 15 minutes. And you slowly work your way up with timed voiding. You're not supposed to do that if you're in pain. We don't want you sitting in pain and winding up the nervous system. You only do it if you don't have pain. So, you know, sometimes we get a bad habit, and our bad habit is that we pee even when we don't need to pee. Like before I started the stream, I went to urinate and it was maybe a drop or two. And there is considerable discussion that sometimes we get so worried about restroom access that we go for it whenever and wherever we can, and we start retraining our bladder to react to smaller volumes. Does that make sense?
Yeah. Have you, in all your years of doing this, have you seen people who have had really big successes with this retraining of their bladder, or is it mixed results?
Well, I mean, I had the guy who invented it at my first IC conference in 1993, and there's a place for it. I mean, is it harmful? As long as you're slow and gradual, I don't believe that it's harmful unless you're allowing yourself to be in pain. That's when they say so they don't want pain patients to do timed voiding. Okay. But what's far more important to me, hon, is you said you had pelvic floor dysfunction, which tells me then, could you still have trigger points in there that are messing you up? What's going on with your pelvic floor now?
Well, I haven't, it hasn't been hurting quite as much, but it's kind of embarrassing, but I got on some antidepressants, and it actually, it helped some of my neurological symptoms. Like I used to have head shaking, and I got on a drug that's an anticonvulsant. Okay. And my head stopped shaking. Okay. So it wasn't like even the antidepressant effects. There was something going on neurologically that was making my head shaking. I mean, I wasn't diagnosed with epilepsy because they did an EEG, but it was weird that a drug that's an anticonvulsant, it's called lamotrigine, that drug that's a drug for epilepsy patients, that actually stopped my head from. Well, do you have essential tremor? Did they tell you that you have essential tremor? It sometimes runs in families. Well, maybe it's the same. Maybe, I don't know. I mean, I have it. You can see it. You can see it sometimes with me because you'll see my head do this. But do you think that the neurological things that cause your head to move might be connected somehow to the nerves in your bladder, like someone who has a sensitive nervous? I don't see any correlation between essential tremor. For me, if more tight my muscles are, the tremor shows. So if my neck starts if I do a lot of work on the computer and I feel my neck muscles get tight,
I will start throwing these kind of movements. I mean, sometimes, like I was Christmas shopping a couple years ago, and I had a lady come up to me, an employee, and she said, what is upsetting you? And I said, what do you mean? I'm not upset. She goes, but you're shaking your head like this. And I went, oh, hon, that's a tremor. It's no biggie.
Oh, okay.
You know, but I just find that it's manifested by tension, by muscle tension.
Right. But how much of it, I mean, I know you're not gonna be able to answer this, but part of why I had all that massive amount of coffee, I mean, of cocoa, is that I started to think that maybe this is all just psychological. Maybe,
No.
and then of course I was very quickly reminded that it's not. But I mean, how much have you found that people who like take antidepressants, for example, are able to reduce their bladder symptoms by drugs that are meant just for the psychological? I mean,
well, but okay,
obviously.
I know, but the big point that you're missing here is an antidepressant physically calms and stabilizes nerves. So they're
Okay.
not giving it to you because you're depressed, as a lot of patients get really offended when a doctor gives you an antidepressant for bladder. They do it because it slows down and calms nerve function throughout the entire body, including in the bladder.
Right, because I think that's what happened to me when I got on this. It helped with my pelvic pain, like, you know, and I mean, so okay, that makes sense.
Yeah, yeah. So,
okay.
but you're dancing around a key issue here. And that is, so you asked my question that you dominantly have frequency, but then you said that you get pain from your muscles.
Well, I don't get pain. The only time I don't have pain if I'm just sitting here normally. The only time I have pain is with intercourse, just penetration, and then
Okay.
it kind of goes away. But yeah, that's when I was diagnosed with the pelvic floor dysfunction, was when the gynecologist put that little this
Speculum.
What do you call it?
Yeah, speculum.
Spectre, and it was like I was in so much pain. He almost said, "Do we need to? Maybe we can't do this," because I was in a lot of pain when he did that.
So what are you doing about that?
Well, I was thinking about buying one of your wand things off your website, and to do, because I don't really have the money to do this out of pocket, because it's not covered by I have Blue Cross Blue Shield insurance. It's good insurance, but for some reason they don't cover it. I think they think of it like getting a body massage or something.
So,
I mean, do most insurance companies not cover it? Because my insurance company doesn't.
Some do, some don't. Kaiser covers it. Mine was covered.
Really? Maybe you know what? It's not the insurance company. It was the place that I called didn't take the insurance. So maybe I need to explore. Maybe my insurance company does cover it. I just assumed that.
Well, I think you need to make some inquiries here. As long as your muscles are tight, your bladder is going to struggle, because the physical reality of tight muscles, aside from pain with intimacy, is it's restricting blood flow to the organs.
And if I'm going to look for a physical therapist that takes my insurance, do you have any that are recommended on your website?
I do. We have a whole database on our website. What state do you live in?
I live in the Washington, D.C. area, but I live in Maryland, but I can go anywhere in the Washington, D.C. metropolitan area.
Okay. And I was just talking to somebody else who was in that area. Another really good referral website is called Pelvic Guru, pelvicguru.com.
Okay.
Is a database. It's the top database for physical therapists and pain specialists. Okay. So just put your zip code in there. Yeah. But I think that if you can even go once and pay out of pocket, pay the $200 or $250 out of pocket for an assessment, and then you're just going to be brutally honest with her and say, listen, it's not covered. I might be able to come once every 4 months. But what I really need is for you to study my body, help me try to understand which muscles are tight, and then give me things that I can do at home so that I can do this on my own. And then I will check back with you like 3 times a year or 2 times a year, and let's see where I'm going. But
Got it.
but
Okay.
that is as important, if not more important, than the antidepressants, because
Okay.
as long as your muscles are tight, your nerves are going to be tweaked. So cause and
Okay.
effect, we've got to get to the cause here. So,
Great.
okay,
Thank you, Jill.
You're-
You're great. You're
y-
wonderful.
you're
Thank you.
good luck, hon. You got this.
Okay.
You got
I
this.
know. Just persistence pays off. I
Yeah.
have to remember that.
Absolutely. Okay, hon.
All right. Thank you.
You are very welcome. All right, Debbie. Hello,
Hi.
Debbie. How are you today, hon?
Oh my God. This is my first time seeing you or listening to your video, and I'm nervous.
Oh, don't be nervous, honey. There's no reason to be nervous. I'll talk about anything.
Okay, thank you very much, and thank you for helping. And okay, I'm gonna give you a quick story, and then you can ask whatever questions you want.
Okay.
I had spine surgery in my neck 3 years ago, ACDF. I had 3 levels done, and now my back's, and I'm in chronic pain from that, and I did that without drugs. I don't like to take medicine. I am scared of pills. I have a heart condition called SVD, so I'm worried everything's gonna affect my heart. And I used to do vitamins, and I did herbs, and I did homeopathic. So I believe in all that stuff. All right, second, my back spine has bulging discs, and I have genetic disc disease, and I'm gonna be 60 years old. So my mom has it too, but I think my lower levels, it might be causing
your
my
lumbar.
chronic pain in my belly.
Okay. Okay.
And
what are your symptoms?
I've been
Wait.
having UT. Oh, sorry. Go ahead.
What are your symptoms? What are your symptoms right
Well,
now? What are you
I
struggling with?
went and saw a urologist. I went and saw a urologist last week, and my symptoms are lower belly pain on the left side is really bad. I winded up in the ER because the pain was so bad. When I stand up, the pressure pushes up. When I'm walking around, it builds up pressure in my left side of my lower belly. I have to pee a lot, and I don't have pelvic pain. I don't have pain in my private area. I don't have any pain inside of it.
Okay, but the pain on the left,
pain on my lower belly.
Okay, wait. The pain on your left, your bladder is immediately above your pubic bone. So if you
maybe 5.
What?
Oh, really? Because she diagnosed me with IC.
Okay, but but honey, come on now. Okay, excuse my fat stomach. This is my cinnamon roll stomach right now. Okay, your bladder is, if you had a line straight down your tummy, your bladder is right here. It is not over here. If you have pain, so I always say, here, hold on. One of the things.
I just ordered 3 bottles of stuff.
Okay, wait. You let me ask you questions here, okay? Okay, so one of the things I always say to patients is, if your pain is always in a spot, if it's always on the left side or the right side, we have to look at the location. And so, yes, you have pain on the left side. The question is it muscle? Or is it, so you have a lot of stuff on your left side. Is the pain on your left side associated with bowel movements? Does it get worse when you have a bowel movement, or is it relieved when you have a bowel movement? Does the pain on your left side get worse when you walk?
Yes.
Okay, so anytime movement is exacerbating pain, we're always going to be looking at muscles. We're going to be looking at your pelvic floor muscles. So did she do a pelvic floor examination?
She did a quick pelvic. I have a GYN appointment Tuesday.
Good.
I have fibroids, and my doctor thinks it's my fibroids, but
I just ordered 3 of your bottles. I ordered Bladder Builder, I ordered the pain one, and I ordered the vitamin one because I thought I had IC. I was thinking embedded UTI, but you don't believe in embedded UTI.
No, and
I was on.
Okay, but embedded UTI does not cause pain on the left side. Okay.
No, no, if it's my fibroids or if it's related to my bulging discs in my lower level.
Okay, so that's what you've got. Okay, so what you've got to do on Tuesday. Okay, let me give you the way I would approach this. Now, remember, I'm not a doctor. I can't give you medical advice. My job is to just open doors for you. I don't want you to walk in and say you've been diagnosed with IC. Do not do that. I want you to walk in and say, doctor, I have pain on this location on the left side that is so severe, I had to go to the emergency room. Can you please help me understand what on my left side, what structure on my left side could be triggering this? And
I had a sonogram done last 2 weeks ago. And they checked my kidneys, my liver, everything, and that came out great. Nothing wrong.
That's great. That's good news. I mean, this is all about ruling stuff out. I
have a colonoscopy, but I won't do that. And she wants to do the camera up my, up there. I don't know if I should do the camera.
Well, okay. Now listen. You are an anatomical mystery to be solved. It is impossible to talk about therapies until we understand what the hell is going on with you. So there are 3 things that we would be looking at for pain on the left side. We would be looking at, do you have a pelvic floor injury? Do you have or like a bad SI joint on the left side or a bad hip? That would potentially explain it. Number 1, is there an issue with your ovary? Your ovary is on your left side. Could there be an ovarian issue? Or is there a problem with your bowel? And right now you don't know and you're guessing. And you deserve more than a guess. It is time now for facts. And so ideally what that gynecologist should be doing is a pelvic examination where she is touching your muscles. Let's see if they can find a trigger point on your left side. Do you remember? Have you fallen?
No.
Did you?
I fall all the time, but not in a while.
Okay, but did you ever like break your tailbone or hurt your tailbone?
No, never broke anything in my body.
Okay.
My toe.
Okay. Were you like a bike rider or anything like that? Were you?
No, I'm not a very exercising person because I have a heart condition.
Okay, and you've had the heart condition for how long?
Since I was in 7th grade. So
okay.
I'm almost 60, so a long time.
Okay. So in many cases, that left side can be the result of, number 1, some sort of traumatic injury. Number 2, it could be because of a skeletal muscle abnormality or a bony structure abnormality. A book you really should get, if not just to understand your left side, is this book, Breaking Through Chronic Pelvic Pain. It is a master class in pelvic anatomy. And as you read it, for anybody watching, as you read this book, I want you to be thinking about previous injuries, anything that might have affected your pelvis. So Dr. Weiss, here's a picture of Dr. Weiss. He's this guy right here. One of the things that baffled him, so he was a urologist who saw very quickly in his IC patients that bladder therapies didn't work. Okay. And he wanted to know why. And so he started looking beyond the bladder and started looking at muscles and nerves. And he really led the way. He is the guy, that first group of clinicians who realized that muscles were a part of the problem. And so if you walked into his clinic and you had trigger points, I would have confidently said you would walk out of that clinic without your trigger points. He became a master at myofascial work. What baffled him is why did the muscle tension and the trigger point come back in exactly the same spot a week later, a month later, 2 months later, whatever. And that's when you have to look at the bony structures. Is there a bony structure abnormality that is putting pressure on this? So here we have our hip bones, right? And we've got our pubic bone, and your bladder is basically, you'll notice your bladder is basically right here. If I put the bladder in the model, see the bladder is just right there, right at the top of that. So that's not your left side. That's your left side pain is not your bladder. Okay, your left side pain is either going to be muscle over here or something else. Okay, so anyway, so why do patients continue to have tight muscles? And they have tight muscles all the time. So the first thing we're going to look at is the hip. Is there an issue with the hip? Because if you, like my mother has a bad hip from a hip replacement that didn't go well. And when she walks like this, right? Because she only has.
Yeah.
She only has.
I walk like limp. I limp.
You limp?
I limp and walk too. Yeah.
Why? Okay, there you go. Why are you limping?
Because my back spine has bulging disc and stenosis, and I have genetic disc disease in the lower level of my back.
Okay.
And
so
it goes to sciatica down my leg.
Okay, so the fact that you have sciatica also means that you have very tight muscles on that side that are pressing the sciatic nerve. So again, chicken versus egg. Only in your case, it's nerve and bladder. Are they connected? Absolutely. If your back is hurting you, your muscles are going to get tight to protect you from the pain. That is a guarding reflex. So the odds are that left side pain is actually probably a trigger point. It's probably a tight group. And is your sciatica on the left side?
Yes.
Oh, there you go. Okay, there you go.
After surgery, my whole left side was screwed up.
Okay. So,
but sometimes the pain is on my right side too, of my lower belly.
Yeah,
but mostly on my left side.
Oh, okay, but so again, think about it this way. If you're walking like this with your left hip lower, right?
Yeah.
You're also tweaking muscles on the right side because your hips are supposed to be level. So if you're tilted and you're walking like this, you're putting unique stresses. My problem is on my left side, and my problem is because of my SI joint. And I just ruptured 2 discs in my back last month. So girl, I totally get it. My right leg, my right knee went numb, and it's still numb a little bit every now and then. Still can't go upstairs as like I used to. I can't run upstairs right now. So bony structure abnormality. And so my left piriformis muscle is working extra hard to keep my SI joint together. But ironically, internally, when I do my pelvic floor work, so like right now, I have pain on my left side. I've had pain in my left butt cheek for 15 years now from this. But internally, when I do my vaginal work, it's the muscles internally on the right side that are the tightest and the most dysfunctional. So look at that. I just messed my chair up. I do that every now and then.
Oh, you okay?
Wait, hold on.
Are you okay?
No, I just moved my foot. Okay, so at that,
oh my gosh.
So at your gynecology appointment, your goal is to get her to study the left side. Okay. You need to know. I would assume
the pain. It feels like something is squeezing and crushing my insides. It just feels like the stabbing, crushing feeling of pain on my left side. And I can't lay.
So you need.
It hurts, and when I sit up, it hurts. When I bend, it hurts.
Right. Okay. So that's not your bladder. None of that's your bladder. So that is a bony structure, nerve, muscle thing going on. And so the great news here is that you've never tried pelvic floor physical therapy, and it's stunningly successful. It is stunningly successful. And I know in my case, especially after my hysterectomy, I had terrible muscle spasms for 10 months. And pelvic floor physical therapy cured it in three treatments. My long-term chronic issue is that my left SI joint is moves. And so until we can get my SI joint stabilized, my muscles are always going to be tight on my left side. And so, my job is to not let them get overly tight. I've got to do my stretches, but more importantly, I've got to do my internal massage. So this is perfect timing for you. You're going to the gynecologist on Tuesday. So again, don't walk in and say you have IC. Please don't do that. You will jump down the rabbit hole. I want you to walk in and talk about the left side pain. And then if the bladder, you can say, you know what, I've also, in addition to the sciatica, I've also had bowel issues. I've also had bladder issues. And also listen, so if she finds that you've got tight muscle, she will send you to a pelvic floor physical therapist who will do a really good, thorough diagnostic workup. And that's very useful. That's data. That's facts. Nobody's guessing anymore. It's proof. You have tight muscles and or trigger points. I'm a little bit concerned about you not wanting to do your colonoscopy, because that's another thing that's happening on the left side. And why are you afraid to do the colonoscopy?
Well, I don't know. I'm scared.
What are you scared? What are you scared of? What are you scared of?
I got the colon box guard box, so I'm gonna try that first.
Okay, wait. Say that again.
I got the colon guard box where you to give a sample of your
Okay.
bowel, and I'm gonna do that first.
Okay.
And then go from there.
So I had a colonoscopy when I turned 50. And I have a really funny story about that. Okay, I have two funny stories about that. Number one, my sister's 5 years older, and I knew she hadn't had a colonoscopy. So I called her out of the blue one day and I said, "Hey, sis, we need to spend some time together. Would you like to get together?" She goes, "Sure." And I said, "Let's have colonoscopies together." And she was like, "No, no." She had 2 C-sections and she lost an ovary, and she has a lot of adhesions around her colon. So she finally just got one and it was fine. Okay. So anyway, that was funny. I tried to get her to do colonoscopy with me.
Oh my gosh.
The hardest part of a colonoscopy is just the prep. And girl, it will fly by. I mean, there's something called the Miralax protocol. That's what I did. Super easy. My version of success for dental work or things like that is if I have no memory of it, it is a success. I don't want to remember a damn thing about it. And so that's why I do sedation dentistry. Anytime they have to drill anything, I do that. It just makes me crazy. So anyway, so I get to the colonoscopy prep center. I'm in bed. They give me the IV. They roll me into the room. And the nurse is kind of talking to me. And I said to her, "This will be a success if I remember nothing." And she kind of looks at me and she's like, "Well, I can't promise that." And I said, "No, you don't understand." Because when I was in my early 20s, I had a sigmoidoscopy in the doctor's office awake. And I kicked the doctor in the face because it hurt so bad.
Oh.
I know, God's honest truth. He didn't prepare me. He didn't tell me. He just stuck it up there and I kicked him out of reflex.
Oh.
And so I said, "You don't understand. If I'm awake, I will kick the doctor. I've already done it once." And so the doctor was over in a corner behind a wall. And his head popped up. He's like, "What? And he comes walking over and he looks at me and he goes, "Are you serious?" And I went, "Oh yeah." God's honest serious. I will kick you. It's my reflex. I said, it is in your
Oh my
best
God.
interest to make sure I am asleep. And he looked at me, and I was super serious. And he looked at her, and he looked at me, and he looked at her, and he nodded his head, and they knocked me out. And I remember nothing. I remember nothing.
See how that's that's the part I'm afraid of. I don't like being put to sleep.
Oh, I do. Hey, listen. Propofol is a beautiful thing. There are lots of different anesthetics, and there's nothing worse than, I remember I had a laparoscopy in 1993, and they sent me home, and I had not peed. And I couldn't pee for like 10 hours. And that was devastating. That's serious pain. So when I was going through my DNC for the whole uterine cancer thing, I said to the anesthesiologist, I said, this is a win if I can pee within 15 minutes of waking up. And he goes, oh, not a problem. I know exactly what I'm going to do. He goes, I'm going to use propofol. You'll fall asleep quick, and you'll wake up quick, and you'll be able to pee right away. And by golly, he was right. I was able to pee right away. And the same thing, even going in for a hysterectomy, I said to the anesthesiologist, I said, listen, I don't want to not be able to pee for 10 hours. I want to be able to pee very quickly. I was able to pee within 30 minutes after my hysterectomy because they used a little bit of propofol instead of the more sedating stuff. So don't be afraid of the anesthesia. Just ask questions.
Oh.
You just have to ask questions. But with your history, with your heart stuff, I have a little heart thing too. You have to have a good discussion with them about what expectations are. But girl, it's about facts. You deserve more than a guess. You have severe pain that brought you to the emergency room. If the physical therapy doesn't find it, or if your muscles are normal tone, I don't think they are. I would bet you money they aren't. But if your muscles do appear to be normal, our next step is to really let somebody just take a quick look at your bowel, and let's just see if there's anything funky going on there.
I will. So you think I just ordered bladder, the bladder one, and I ordered a couple of your vitamins from your website, thinking, well, I see, but I can still take them, right?
Well, I don't know what's wrong with you, hon. You don't know what's wrong with you. You're guessing. So I don't know.
Worth of vitamins.
I know, but honey, when you take a lot of vitamins, you're just creating a vitamin stew. You're just hoping and praying that you're going to find a quick fix. It's not that easy. Yeah. The odds.
Do you think fibroids can cause this pain?
Absolutely.
Because I have very tiny ones, so.
A fibroid tumor could easily cause some of this pain. So I think it's really premature to be looking at any sort of supplement. I do. I mean, you also could have some estrogen atrophy going on. You are 50. You are
60, almost 60. I've been off I haven't had a period in over 5 years.
Okay, so the other thing is you're in estrogen atrophy, like I'm in estrogen atrophy. And your bladder and your urethra need estrogen. Your bladder's like your mouth. It's a hollow organ covered with a thick coating of mucus. And the purpose of that mucus is to protect that tissue. And the problem is that mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus. When you're older, you have much less estrogen, you have much less mucus. Thus, your bladder's ability to defend itself is now compromised. That's not a disease. That's estrogen atrophy. And you should Google estrogen atrophy or genital urinary syndrome of menopause so that you can learn some of those symptoms. But again, that would not account for left side pain. You have sciatica. Sciatica proves you have tight muscles that are compromising nerves. So I still think that the muscle connection has to be explored in depth too. Okay?
Okay,
hon.
Definitely look. I would definitely look into what you said. Because I can't take it. Been maybe years of being in pain on and off like this. they just, and then my doctor says UTI infection. She just gave me antibiotics, but the urologist doesn't. She's saying IC, and
I know,
like,
but
I'm getting all confused.
well, but it's not confusing. I mean, pelvic pain is confusing, but when you break it into its individual elements, it makes a lot more sense. You have sciatica. Okay. Sciatica is caused by tight muscles the piriformis muscle squeezing that nerve. So we already now know you have tight muscles. What you did not know is that tight muscles restrict blood flow to the bladder and can be can create more dysfunctional nerves. Cause and effect, it's cause and effect. The odds are your bladder is a secondary victim of another fundamental issue. And that fundamental issue is either going to be tight muscles, a fibroid tumor, or estrogen atrophy. Those are the three most common things that we would see. So who cares what the name is? You can't be, don't obsess about the name.
Fibroid tumor,
if it's fibroid tumors, what? Okay, don't worry about the name.
Tumor, is that?
Okay, wait. Let me finish. Don't obsess over the name. You need to ground them back to your anatomy. Say, I don't care what you call it. I want to understand physically what's happening inside my pelvis. What is at this location on the left side? And is this connected to the fact that I have sciatica on the left side? Or could this be my ovary? Or could this be a fibroid tumor? Or could this be something related to my bowel? And you're just going to start checking things off here. Okay. And given your history and the fact that you've had pain for a long time because of your back, your muscles, your body tightens your muscles to protect you from pain. And so you probably have had tight muscles for a very, very, very long time. And so
now, what do you recommend if it is fibroid tumor? It cannot be treated naturally.
Well, the fibroid tumor should stop growing because you're no longer producing estrogen. The question is how big is it? And is it physically pushing on something? If it's physically pushing on something, they might want to remove it.
Okay.
But don't catastrophize. Now, listen, I know by saying that right now, you're going, oh my God, I might have to have surgery. I'm not saying that. I'm not saying that at all. I can see in your face that's where you're going.
I know.
You don't.
I just can't take it anymore.
Well, I know, but honey, I totally understand that. I totally understand that you are overwhelmed and frustrated and you're exhausted and you just, for God's sake, don't want to be in pain anymore. The great news here, unlike 20 years ago, is we now understand cause and effect, hon. And so you have the opportunity on Tuesday to get the most important information that you've needed about this, and that is that gynecology visit. So just try to have her. And again, you are the boss, you pay them, they don't pay you, right? And so I want you to be very strong and confident and say, I am here to solve a mystery. I do not know what is causing this left side pain. It was so severe, I ended up at the emergency room. I have sciatica on the left side. But I also have fibroid tumors. And so what I would love for you to do for me today is to explore the left side of my pelvis and tell me, are my muscles tight? Could it be a trigger point? Could it be a fibroid or an ovary? And just open it up to God here. I mean, lots of deep breathing. It's going to be really vital information. If she goes, oh my God, your muscles are so tight, I can barely stick my finger in there. The great news is that pelvic floor physical therapy can heal that. It will restore blood flow. Pelvic floor physical therapy is stunningly successful for the great majority of women who use it. And you've never tried it.
when I went to the urologist a couple of days ago, who diagnosed me with the IC and wanted to put the camera and gave me Elmeron, which I'm not taking because I read about that. But she did a quick pelvic exam and she said, "Let me see if you need pelvic therapy." She goes, "Do a Kegel," and while she had a finger in there, and I said, "Okay." She goes, "Oh no, you're fine. You don't need physical therapy for your pelvic."
But that's not the appropriate test.
No.
A good pelvic floor assessment, what a physical therapist will do is they will be following lines of muscles. So they're going to be touching different muscle groups to see if they can find a tender spot. And so generally the urologist and the gynecologist, they're in and out of there in a couple of seconds. What we need is a really thoughtful exploration of your left side anatomy. So the gynecologist might be able to do that for you. But you need to tell her that you have left side sciatica. That's an important piece of this puzzle. And also tell her that you have some compressed vertebrae and or some compressed discs, bulging discs. And give her that context here. And also the other thing you want her to do is you want her to look at the quality and health of your skin and see if you got estrogen atrophy going on. If you do, if your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. And so that's where using a topical estrogen product might be really, really helpful.
Is there any natural ones that you recommend for that?
There's no natural ones. Your body needs real estrogen to produce real mucus. So I don't know if it's appropriate for you. That's why you're going for that opinion for her. But when you give, a lot of people think supplements or treatments can heal the bladder. No, they can't. The only thing that can heal the bladder is the bladder. Our job is to create an environment to support healing, and our job is to perhaps try to give those tissues something that they can use in that healing process. And that's what estrogen is. When you give those tissues estrogen, they produce mucus. And that's what you need. That will fix the dryness naturally because you are giving the body the opportunity to produce its own natural mucus. So I hope that helps. Does that help a little bit?
Yeah, that helps a lot. When I go in there Tuesday, I know what to say now. And you helped so much about that. So the estrogen thing would be a prescription. And is there anything that's safer than that I have to worry about? Anything, side effects?
I want you to stop worrying. Don't let anxiety and worries prevent you from going to doctor's appointments and having good discussions with your doctors. Having a good discussion about safety is exactly what you want to do, but you got to do your research ahead of time. If you research topical estrogen safety, you can read the research that shows that it's considered remarkably safe. So nobody's saying you're taking a pill, because when you take a pill, it gets disseminated throughout your whole body. And that's why. But a topical therapy, especially if you use it on the outside on the vulva, generally stays in the skin and does not get into the bloodstream to any great degree. But you do the research. You read about it first so you can have a discussion with her about that. Okay?
Okay. I will.
Hey, listen, you got this, but I need you to walk in strong, confident, informed, and prepared. I don't want you to walk in and burst into tears. It's like, okay, doc, listen, I know we got a limited amount of time. I'm here because I'm trying to solve my left side pain. I don't know if it's tight muscles. I don't know if it's my ovary. I don't know if it's my bowel. What I can tell you is I have sciatica. I would love for you to do a pelvic examination and just see if you feel anything weird on my left side. And I would really love for you to look at my skin and see if I'm showing estrogen atrophy. Bam, done. Look at how long it took me 30 seconds to say that. Then, that's when the work happens. Then, let's get her in there and let's see what she can find to see if she feels anything abnormal. Okay?
Okay.
Okay,
All
hon.
right. Thank
You got
you.
this. You got this. Be
All right.
strong.
Thank
Okay.
you so much.
You're very, very
Bye.
welcome. Bye-bye.
Okay, bye. Thank you.
All right. All right. The Zoom meeting is over. I'm coming back to Facebook and I'm coming back to YouTube. I hope y'all found those interesting. Now, obviously, I've missed some of what you're saying. And of course, now the Super Bowl is happening. So let me just see if we've got Boria. Thank you so much for the 50 stars. So appreciative. Sam, thanks so much for taking my Zoom call, Jill. It was great. Oh, you're welcome, hun. Oh, good. I'm glad you joined the Bladder Health Group. Sarah says, do I think allergy shots help? If you have a history of allergies, allergies manifest in the bladder. That's well known that I see patients with allergies flare during allergy season. And so using an antihistamine and or allergy shots make total sense. Sarah says, I need help on which test to buy for the next gen test. You're going to do the urine test. Unless you're also having vaginal stuff, then you can do the vaginal test. The urine test. Mary says, does estrogen atrophy cause neurostimulation of the bladder wall? Referring to the girl that called. Yeah, if you have estrogen atrophy, that alpha afferent nerve is going to be far more exposed and far more triggerable. All right, you guys. Well, listen, I don't know about you, but I want to go watch the festivities and I'm going to make poo-poos. My bladder-friendly poo-poos are tortilla chips, refried beans, cheddar cheese, and avocado. So I'm going to go make a big platter of poo-poos for my family as we watch the Super Bowl. So I wish you well. If you found this helpful, please know we'll be back next Sunday. Come on over to our website. Sign up for our newsletter. For God's sake, it's freaking free. It's great information. I do not abuse you. I do not send out a lot of emails, but I do try to be very, very informative. All right. All righty. All right. Be well, everybody. Have a good one. All righty. Thank you, YouTube. Last call for questions. Facebook is shut down. All right. I'll see you guys later. Have a good one.